Did you know that over 40% of international nurses say language barriers affect patient safety in their workplace? That's not just a statistic, it's your career, your confidence, and your patients' well-being on the line. Welcome to Learning English Pro. I'm Ger, a CELTA qualified English teacher, and this channel is dedicated to real-world English for nurses, doctors, and healthcare professionals around the world. Today, you're getting 1,000 English phrases for nurses, from patient care to palliative support, emergencies, and to mental health. It's my most in-depth video yet, and it's designed to help you speak clearly, confidently, and professionally, no matter where you work. This lesson is supported by an 80-page printable guide with every phrase organized by topic, ready to review and study. It includes all 1,000 phrases sorted by lesson, phrase-by-phrase formatting for faster revision. I've included exercises so you can test yourself, and there's a bonus section with additional links and resources. This guide is available to my student members as part of their membership, and you can also buy it as a one-time download in my YouTube store for just $4.99. But here's the thing, student membership is also just $4.99 per month. That means for the same price as one guide, you get every professional guide I've ever made, access to 200 plus archive lessons, worksheets, publications, and bonus learning materials, priority replies and early content, and so much more. If you plan to learn more with me, membership is the best value by far. So click join under any video to become a student member today, or grab the guide directly in the YouTube store if that works better for you. Let's dive into our lesson. The 1,000 English phrases for nurses are divided up into different sections by topic. In the video description, you'll find a list of them with their timestamps, so if you wish to navigate ahead to a lesson of your choice, you can do that quite easily. This lesson is also great for passive listening. Put it on in the background and go about your day or while you're on your way to work. It's a great way to engage with your passive learning skills. This is your Medical English Masterclass, 1,000 phrases and one goal, your confidence in speaking English in a healthcare setting. Let's get into our first lesson, 100 phrases for nurses. The phrases covered in this lesson are day-to-day and general and suitable for all nurses. In this lesson, we'll cover 100 useful phrases divided into topics such as patient admission, taking vital signs, medication administration, patient care, wound care, patient education, communication with doctors, emergency situations, and discharge instructions. These phrases will help you navigate various scenarios with confidence and clarity. So let's get started. Grab your notebooks and let's dive into today's lesson. Remember, practice makes perfect, and I'm here to support you every step of the way. And our first topic is patient admission. Welcome to our facility. How are you feeling today? Welcome to our facility. How are you feeling today? Can you please fill out this form? Can you please fill out this form? Do you have any allergies? Do you have any allergies? What brings you here today? What brings you here today? Can you describe your symptoms? Can you describe your symptoms? Do you have any existing medical conditions? Do you have any existing medical conditions? Are you currently taking any medications? Are you currently taking any medications? Have you been hospitalized before? Have you been hospitalized before? We need to take your vital signs. We need to take your vital signs. Please provide a sample of your urine. Please provide a sample of your urine. Well done, that's 10 phrases learnt already for the world of nursing. Next up, let's take a look at some phrases relating to taking a patient's vital signs. I need to take your blood pressure. I need to take your blood pressure. Please roll up your sleeve. Please roll up your sleeve. I'm going to check your temperature. I'm going to check your temperature. Let me measure your pulse. Let me measure your pulse. I need to listen to your heart and lungs. I need to listen to your heart and lungs. Please breathe in and out slowly. Please breathe in and out slowly. Your vital signs are normal. Your vital signs are normal. Your blood pressure is a bit high. Your blood pressure is a bit high. Your temperature is elevated. Your temperature is elevated. I need to record your oxygen levels. I need to record your oxygen levels. Now it's time to move on to our third topic, which is medication administration. It's time for your medication. It's time for your medication. Have you taken this medication before? Have you taken this medication before? Please take this pill with water. Please take this pill with water. Do you have any difficulty swallowing pills? Do you have any difficulty swallowing pills? This injection might sting a bit. This injection might sting a bit. I'll need to give you an IV. I'll need to give you an IV. Are you experiencing any side effects? Are you experiencing any side effects? This medication should help with your pain. This medication should help with your pain. Make sure to take this with food. Make sure to take this with food. Let me know if you feel any discomfort. Let me know if you feel any discomfort. It's time to move on to our next topic, which is patient care. How are you feeling today? How are you feeling today? Do you need help with anything? Do you need help with anything? Are you in any pain? Are you in any pain? Can you rate your pain on a scale from 1 to 10? Can you rate your pain on a scale from 1 to 10? Let me help you sit up. Let me help you sit up. I will assist you to the bathroom. I will assist you to the bathroom. Do you need help changing your clothes? Do you need help changing your clothes? Let me adjust your pillow. Let me adjust your pillow. Would you like a blanket? Would you like a blanket? Can I get you anything to drink? Can I get you anything to drink? We are already on our 5th topic, wound care. I need to change your dressing. I need to change your dressing. This might hurt a little. This might hurt a little. I'm going to clean the wound now. I'm going to clean the wound now. We need to keep this area dry. We need to keep this area dry. Please try not to touch the wound. Please try not to touch the wound. The wound is healing nicely. The wound is healing nicely. I'm going to apply some antibiotic ointment. I'm going to apply some antibiotic ointment. You may feel a bit of pressure. You may feel a bit of pressure. I will bandage this up for you. I will bandage this up for you. Let me know if it starts bleeding again. Let me know if it starts bleeding again. We are halfway through our English lesson on phrases for nurses. Next up, our topic is patient education. It's important to take your medications as prescribed. It's important to take your medications as prescribed. You need to follow a low-sodium diet. You need to follow a low-sodium diet. Regular exercise is beneficial for your health. Regular exercise is beneficial for your health. Make sure to stay hydrated. Make sure to stay hydrated. Here's how to manage your condition at home. Here's how to manage your condition at home. Always wash your hands before eating. Always wash your hands before eating. Avoid smoking and excessive alcohol consumption. Avoid smoking and excessive alcohol consumption. Monitor your blood sugar levels regularly. Monitor your blood sugar levels regularly. This pamphlet contains useful information. This pamphlet contains useful information. If you have any questions, don't hesitate to ask. If you have any questions, don't hesitate to ask. Our seventh topic is communication with doctors. I need to update the doctor on your condition. I need to update the doctor on your condition. The doctor will be in to see you shortly. The doctor will be in to see you shortly. Let me check with the doctor about that. Let me check with the doctor about that. The doctor has prescribed a new medication for you. The doctor has prescribed a new medication for you. I need to report this symptom to the doctor. I need to report this symptom to the doctor. The doctor has ordered some tests. The doctor has ordered some tests. I will consult with the doctor about your treatment. I will consult with the doctor about your treatment. The doctor has requested a follow-up appointment. The doctor has requested a follow-up appointment. I'll inform the doctor about your pain. I'll inform the doctor about your pain. The doctor will review your test results. The doctor will review your test results. In our next topic, we will take a look at phrases you can use in an emergency situation. We need to act quickly. We need to act quickly. Stay calm, we are here to help. Stay calm, we are here to help. Call for emergency assistance. Call for emergency assistance. I need to check your vital signs immediately. I need to check your vital signs immediately. Please follow my instructions. Please follow my instructions. Are you experiencing chest pain? Are you experiencing chest pain? We need to start CPR. We need to start CPR. The defibrillator is on its way. The defibrillator is on its way. I need to stabilize you before the doctor arrives. I need to stabilize you before the doctor arrives. You are in good hands. You are in good hands. Let's move on to our penultimate topic, discharge instructions. You are ready to be discharged. You are ready to be discharged. Here are your discharge papers. Here are your discharge papers. Make sure to follow up with your primary care physician. Make sure to follow up with your primary care physician. These are your home care instructions. These are your home care instructions. Take your medication as directed. Take your medication as directed. Schedule a follow-up appointment. Schedule a follow-up appointment. If you experience any complications, contact us immediately. If you experience any complications, contact us immediately. Keep the wound clean and dry. Keep the wound clean and dry. Avoid strenuous activities. Avoid strenuous activities. Thank you for choosing our facility. Thank you for choosing our facility. It's time to move on to our final topic for this lesson, general courtesy. How can I assist you today? How can I assist you today? Please let me know if you need anything. Please let me know if you need anything. I'm here to help you. I'm here to help you. Your comfort is our priority. Your comfort is our priority. Thank you for your patience. Thank you for your patience. I appreciate your cooperation. I appreciate your cooperation. We aim to provide the best care possible. We aim to provide the best care possible. Feel free to ask any questions. Feel free to ask any questions. I will be with you shortly. I will be with you shortly. Have a great day. Have a great day. Well done, you've learned 100 new phrases. These phrases should help nurses in their daily interactions and ensure clear, effective communication with patients, doctors, and other healthcare staff. Great job! Those 100 phrases are the heart of everyday communication. Now let's level up with 200 powerful new vocabulary phrases used in real clinical conversations. Remember, you can download the full guide in the YouTube store or access it as part of the student membership. Did you know that over 3.6 billion diagnostic medical imaging scans are performed worldwide every year? That means that healthcare professionals like you need to understand and use medical imaging vocabulary accurately to communicate effectively with colleagues and patients. Hi, I'm Jer and this is Learning English Pro, the channel where healthcare professionals like you excel in English and advance in their careers. In today's lesson, we're learning 50 essential terms and phrases for radiology and medical imaging. These are the words and expressions you need when discussing scans, explaining procedures, and understanding imaging results, whether you're working with X-rays, MRIs, CT scans, or ultrasounds. This is the fourth episode in my healthcare vocabulary series. Previously, we covered mental health, physiotherapy, and phlebotomy. But don't worry if you missed these episodes, they are included right after this lesson on radiology and medical imaging, so just stay tuned to get all the vocabulary you need. For each term that we look at today, you'll learn the pronunciation, the form, the definition, and I'll give you an example phrase so you'll be able to understand the context of the word. Medical imaging is essential for diagnosing and monitoring a wide range of conditions. Healthcare professionals must be familiar with different types of scans and their specific uses. X-ray. Repeat after me. X-ray. An X-ray is a radiographic image produced using ionizing radiation, commonly used to detect fractures and infections. Let's take a look at our example sentence. We'll take an X-ray of your chest to check for pneumonia. Let's move on to our next term. CT scan. CT scan. Otherwise known as computed tomography. This is a detailed imaging method that uses X-rays to create cross-sectional images of the body. The doctor ordered a CT scan to get a clearer picture of your abdomen. MRI. MRI. Otherwise known as magnetic resonance imaging. This is a scan using magnetic fields and radio waves to create detailed images of soft tissues. You'll need to lie still during the MRI so we can get accurate images. Ultrasound. Ultrasound. An ultrasound is an imaging technique that uses high-frequency sound waves to visualize internal structures. We're going to do an ultrasound to check your baby's development. Mammogram. Mammogram. A mammogram is a specialized X-ray used to detect abnormalities in breast tissue. Your mammogram results will be reviewed by a specialist. Fluoroscopy. Fluoroscopy. A fluoroscopy is a continuous X-ray technique that allows real-time imaging of movement in the body. The fluoroscopy will help us guide the catheter into position. Let's move on to DEXA scan. DEXA scan. Otherwise known as dual energy X-ray absorptiometry. This scan is used to measure bone density and assess osteoporosis risk. Let's check out our example. We're scheduling a DEXA scan to check for bone loss. Contrast imaging. Contrast imaging. Contrast imaging is a technique using a contrast agent to enhance the visibility of certain structures in scans. You'll need to drink a contrast liquid before your CT scan. PET scan. PET scan. Otherwise known as a positron emission tomography. This is a nuclear imaging technique used to observe metabolic activity in tissues. The PET scan will help us detect any abnormal cell activity. Angiography. Angiography. Angiography is a specialized imaging technique used to visualize blood vessels. Angiography will help us assess any blockages in your arteries. Radiology professionals use a variety of specialized equipment to capture clear and accurate images for diagnosis. Let's take a look at some of these in our next batch of terms. Radiograph. Radiograph. A radiograph is a medical image produced by X-rays. The radiograph shows a small fracture in your wrist. Scanner. Scanner. This is a general term for any machine that can capture medical images. Please step onto the scanner bed and we'll begin the process. Transducer. Transducer. This is the handheld device used in ultrasound imaging to send and receive sound waves. I'll apply some gel before using the transducer on your abdomen. Lead apron. Lead apron. A lead apron is a protective garment worn to shield against radiation exposure. We'll place a lead apron over you to protect your organs from radiation. Contrast dye. Contrast dye. This is a substance used to enhance the visibility of certain structures in scans. You may feel a warm sensation when the contrast dye is injected. Radiation shield. Radiation shield. A radiation shield is a protective barrier used to reduce radiation exposure. The radiation shield will protect you during the procedure. Imaging plate. Imaging plate. An imaging plate is a component of digital radiography that captures X-ray images. We need to replace the imaging plate before taking another scan. Collimator. Collimator. This is a device used in imaging machines to focus X-ray beams. The collimator helps minimize unnecessary radiation exposure. Barium swallow. Barium swallow. This is a diagnostic test using barium contrast to examine the esophagus. You'll need to drink this solution for the barium swallow test. Gamma camera. Gamma camera. A gamma camera is a device used in nuclear medicine to capture gamma radiation images. The gamma camera will track the radioactive tracer in your body. Our next set of terms are useful for radiology professionals when they must guide patients through procedures with clarity and to ensure a patient's comfort during imaging tests. Positioning. Positioning. Positioning is the process of placing a patient correctly for an imaging scan. I'll adjust your positioning so we get a clear image. Exposure time. Exposure time. This is the duration a patient is exposed to X-ray radiation. The exposure time will be brief to minimize radiation. Scan duration. Scan duration. Scan duration is the time required to complete a scan. The MRI scan duration will be about 30 minutes. Next up, we have a phrase. Hold your breath. Hold your breath. And this is a common instruction to patients during scans. Please hold your breath for a few seconds while we take the image. Lie still. Lie still. This phrase is an instruction given to prevent motion artifacts in imaging. Try to lie still so we can get a clear picture. Turn onto your side. Turn onto your side. This phrase is a command given during certain imaging procedures. Please turn onto your side for this next image. Contrast injection. Contrast injection. The contrast injection is the process of injecting a contrast agent into the patient. You might feel a slight flush when we administer the contrast injection. Monitor for reactions. Monitor for reactions. This phrase relates to checking for allergic responses to contrast dye. We'll monitor for reactions after the contrast is injected. Remove metal objects. Remove metal objects. Here we are giving patients a common pre-scan instruction to remove things like jewellery and belts. Please remove any metal objects before the MRI. Follow my instructions. Follow my instructions. This phrase is a general instruction given to patients during scans. Please follow my instructions carefully for the best results. Let's move on to our next topic. These terms are useful after imaging is completed, when medical professionals must accurately describe their findings to ensure proper diagnosis and treatment. Abnormality. Abnormality. An abnormality can be any unusual or unexpected change in structure or function seen on an imaging scan. The scan shows a small abnormality in the lower spine, which we need to investigate further. Lesion. Lesion. A lesion is a region of damaged or diseased tissue. The MRI revealed a lesion in the liver that requires further analysis. Fracture. Fracture. A fracture is a break or crack in a bone, often identified on an X-ray or CT scan. The X-ray confirmed a stress fracture in the patient's tibia. Nodule. Nodule. A nodule is a small mass or lump of tissue, often found in the lungs, thyroid, or other organs. The CT scan detected a pulmonary nodule in the right lung. Edema. Edema. An edema is a swelling caused by excess fluid in body tissues. The MRI indicates significant edema around the knee joint. Effusion. Effusion. This is the abnormal accumulation of fluid in a body cavity, often seen in the lungs or joints. The ultrasound shows a mild pleural effusion in the left lung. Calcification. Calcification. Calcification is the buildup of calcium in tissues, making them appear denser on scans. The mammogram shows calcification in the breast tissue, which needs further evaluation. Mass. Mass. In this context, a mass is a large abnormal growth or lump seen on an imaging scan. The MRI shows a mass in the abdomen, which may require a biopsy. Atrophy. Atrophy. Atrophy is a decrease in the size of an organ or tissue due to disease or lack of use. The MRI suggests muscle atrophy in the lower leg following prolonged immobility. Metastasis. Metastasis. This is the spread of cancer cells from the primary tumor to other parts of the body. The PET scan confirms metastasis to the liver and lymph nodes. In our final section, we'll be looking at adjectives and how we can use them to provide precise descriptive language, which can help radiologists and healthcare professionals communicate imaging results effectively. Our first adjective is benign. Benign. Benign means that something is not cancerous and generally not harmful. The scan shows a benign cyst that does not require treatment. Malignant. Malignant. A growth which is malignant is one which is cancerous and potentially aggressive. The biopsy confirms that the mass is malignant and requires further intervention. Enlarged. Enlarged. The adjective enlarged describes when something is bigger than normal in size, often indicating swelling or abnormal growth. The ultrasound detected an enlarged liver, which could suggest infection or disease. Opaque. Opaque. We use opaque to describe when something is not allowing radiation or light to pass through, often appearing white on X-rays. The chest X-ray shows an opaque area that could indicate pneumonia. Dense. Dense. This word describes having a high level of tissue or material compactness, making it appear whiter on scans. The mammogram reveals dense breast tissue, which may require further imaging. Irregular. Irregular. If something is irregular, it is uneven or asymmetrical in shape, often requiring further investigation. The MRI shows an irregular mass in the pancreas that needs further testing. Hyperintense. Hyperintense. If something is hyperintense, it is appearing unusually bright on an MRI scan, often indicating fluid or high protein content. The hyperintense region in the brain scan may suggest inflammation. Hypointense. Hypointense. Hypointense indicates something appearing darker than surrounding tissue on an MRI scan. The hypointense area in the kidney may indicate reduced blood flow. Diffuse. Diffuse. We can use this word to describe when something is spread out over a large area rather than being localized. The CT scan shows diffuse swelling in the abdominal cavity. Our final term for this lesson is well-defined. Well-defined. We can use this adjective term to describe when something is having a clear, distinct edge, which can indicate a non-aggressive or benign condition. The lesion appears well-defined, suggesting it is not malignant. Well done, you've just learned 50 essential terms for radiology and medical imaging, a crucial area of English for healthcare professionals. Remember, if you're a student member, you can download the full PDF guide with all the terms from today's lesson, plus additional exercises to help reinforce your learning. If you haven't joined yet and want to boost your healthcare English skills, just click the link in the video description to become a student member today. And stay tuned, don't go anywhere, because up next is another important lesson, 50 essential terms for mental health. Mental health is a critical part of patient care in all healthcare contexts. Whether you're a psychologist, a therapist, nurse, doctor, or any professional working with patients, this lesson is packed with valuable vocabulary you'll use every day. Let's get straight into our 50 essential healthcare terms for mental health. Our first set of words focus on diagnostic terms. Our first word is neurodivergent. Repeat after me. Neurodivergent. This adjective describes individuals whose neurological development and functioning differ from societal standards of normal. Let's take a look at our example sentence. The patient identifies as neurodivergent, exhibiting traits consistent with autism spectrum disorder. Let's move on to bipolar disorder. Bipolar disorder. This is a mental health condition characterized by extreme mood swings, including manic and depressive episodes. The patient has been diagnosed with bipolar disorder and is currently experiencing a manic phase. Next up is schizophrenia. Schizophrenia. This word describes a severe mental disorder involving distorted thinking, perceptions, and a diminished ability to function. Early intervention is crucial in managing schizophrenia to improve long-term outcomes. Next up, we have obsessive-compulsive disorder, better known as OCD. This disorder is characterized by unwanted recurring thoughts or obsessions and repetitive behaviors or compulsions. Let's check out our example sentence. Cognitive behavioral therapy is effective in treating patients with obsessive-compulsive disorder. Another common disorder is post-traumatic stress disorder, better known as PTSD. This is a condition triggered by experiencing or witnessing a traumatic event, leading to severe anxiety and flashbacks. The veteran was diagnosed with PTSD following his return from active duty. Our next batch of words deals with symptomatic terms. Anhedonia. Repeat after me. Anhedonia. This noun describes an inability to experience pleasure from activities usually found enjoyable. The patient's anhedonia is a significant barrier to engaging in therapeutic activities. Affective flattening. Affective flattening. This term describes a reduction in the expression of emotions, often seen in facial expressions and voice tone. Affective flattening was observed during the mental status examination. Let's move on to our next term, hypervigilance. Hypervigilance. This is an enhanced state of sensory sensitivity and exaggerated awareness of surroundings. Hypervigilance in the patient suggests underlying anxiety issues. Our next word is rumination. Rumination. Rumination is the act of continuously thinking about the same thoughts, often negative, which can contribute to depression. Let's check out our example sentence. Addressing rumination is essential in the cognitive therapy of depression. Psychomotor agitation. Psychomotor agitation. This term describes unintentional and purposeless motions stemming from mental tension and anxiety. The patient's psychomotor agitation has decreased with the new medication regime. Our next topic is treatment-related terms. Psychopharmacology. Psychopharmacology. This is the study of the use of medications in treating mental disorders. Let's check out our example sentence. Advancements in psychopharmacology have improved outcomes for patients with mood disorders. Let's move on to cognitive behavioral therapy, better known as CBT. This is a type of psychotherapy that helps patients identify and change negative thought patterns and behaviors. CBT has been effective in reducing symptoms of anxiety and depression in adolescents. Next up, we have electroconvulsive therapy, also known as ECT. This is a medical treatment involving electrically induced seizures to treat severe mental disorders. ECT is considered when patients with severe depression do not respond to medication. Next up, we have mindfulness-based stress reduction, also known as MBSR. This is a therapeutic approach combining mindfulness meditation and yoga to reduce stress. MBSR programs have been integrated into treatment plans for patients with chronic anxiety. Let's move on to dialectical behavior therapy, also known as DBT. This is a form of therapy designed to help individuals manage intense emotions and reduce self-destructive behaviors. DBT is particularly effective for patients diagnosed with borderline personality disorder. Our next section deals with descriptive terms used in mental health care. Euthymic. Euthymic. This adjective pertains to a normal, stable mood state, neither depressed nor manic. Let's check out our example sentence. The patient has remained euthymic for several months with ongoing treatment. Let's move on to labile. Repeat after me. Labile. In mental health, labile describes emotions characterized by rapid and unpredictable changes. The patient's mood was labile, shifting from tears to laughter within minutes. Our next term is dysphoric. Dysphoric. Dysphoric is used to describe when a patient is experiencing a state of unease or generalized dissatisfaction. The patient reported a dysphoric mood throughout the past week. Psychosomatic. Psychosomatic. This term relates to physical symptoms caused or aggravated by mental factors. Stress can lead to psychosomatic symptoms such as headaches and stomach aches. Somatic. Somatic. And this adjective describes symptoms relating to the body, especially as distinct from the mind. The patient presented with somatic complaints, including fatigue and muscle pain. Our next batch of words relate to common behavioral terms used in mental health care. If you've been affected by any of the terms covered, please make sure to seek help from a professional. Self-harm. Self-harm. This is the act of deliberately inflicting pain or injury on oneself. The patient has a history of self-harm but denies any recent incidents. Suicidal ideation. Suicidal ideation. This is the presence of thoughts about or planning suicide without necessarily making an attempt. The patient reports experiencing passive suicidal ideation but denies any intent or plan to act on it. Addiction. Addiction. Addiction is a compulsive dependency on a substance or behavior, often leading to harmful consequences. The patient's addiction to opioids has led to significant health complications. Compulsion. Compulsion. A compulsion is a repetitive, irresistible urge to perform a behavior, often linked to OCD. Hand washing has become a compulsion for the patient, interfering with daily activities. Delusion. Delusion. A delusion is a firmly held, false belief that is resistant to evidence or logic. The patient exhibits delusions of grandeur, believing they have supernatural abilities. Hallucination. Hallucination. This is a sensory perception that occurs in the absence of an external stimulus, often auditory or visual. Auditory hallucinations are a common symptom in schizophrenia. Derealization. Derealization. This is a feeling of detachment from one's surroundings, as if the external world is unreal. During periods of high anxiety, the patient experiences derealization, experiencing the world as dreamlike. Disassociation. Disassociation. This is a mental process where a person disconnects from thoughts, feelings, memories, or identity. The patient disassociates during stressful events, reporting memory gaps and emotional numbness. Hyperfixation. Hyperfixation. An intense and prolonged focus on a specific interest or activity, often linked to ADHD or autism. The patient describes hyperfixation on video games, leading to neglect of personal hygiene. Codependency. Codependency. Codependency is a behavioral condition where one person enables another's addiction or unhealthy behavior. The therapist is working with the patient to establish boundaries in their codependent relationship. Emotional dysregulation. Emotional dysregulation. This is difficulty managing emotional responses appropriately. Patients with borderline personality disorder often struggle with emotional dysregulation. In our next section, we're going to take a look at common mental health verbs. Diagnose. Diagnose. To diagnose is to identify a medical condition based on symptoms and tests. The psychiatrist diagnosed the patient with generalized anxiety disorder. Medicate. Medicate. To medicate is to administer medication as treatment. The patient was medicated with an SSRI to manage depressive symptoms. Prescribe. Prescribe. This verb means to authorize the use of specific medication or treatment. The doctor prescribed an antidepressant to help regulate mood. Stabilize. Stabilize. This word means to bring a patient's condition to a steady, controlled state. The goal is to stabilize the patient's mood swings through therapy and medication. Let's move on to regress. Regress. To regress is to revert to a previous, less advanced state of mental or emotional well-being. After discontinuing therapy, the patient showed signs of emotional regression. Suppress. Suppress. This word means to reduce or inhibit a mental or emotional response. The medication helps suppress intrusive thoughts in patients with OCD. Our next term is to cognitively reframe. Cognitively reframe. And this means to shift perspective on a thought or belief to reduce stress. Cognitive reframing is a key technique in treating negative thought patterns. Disclose. Disclose. To disclose means to reveal or share personal information, often in a therapeutic setting. The patient was hesitant to disclose past trauma, but gradually opened up. Reinforce. Reinforce. To reinforce means to strengthen a behavior or thought pattern, either positively or negatively. Therapists use positive reinforcement to encourage healthy coping strategies. Validate. Validate. To validate is to acknowledge and affirm someone's emotions or experiences. It's important to validate the patient's feelings before offering solutions. In our final section, we're going to take a look at medications and therapy-related terms used in mental health care. First up, we have SSRI, or Selective Serotonin Reuptake Inhibitor. This is a class of antidepressants that increase serotonin levels in the brain. Let's take a look at our example sentence. SSRIs, like fluoxetine, are commonly prescribed for depression and anxiety disorders. Anxiolytic. Anxiolytic. An anxiolytic is a medication that reduces anxiety. The patient was prescribed an anxiolytic to manage panic attacks. Mood stabilizer. Mood stabilizer. A mood stabilizer is a type of medication that helps balance mood fluctuations, often used in bipolar disorder. Lithium is a widely used mood stabilizer for bipolar disorder. Neuroleptic. Neuroleptic. Neuroleptic is another term for antipsychotic medication used to treat conditions like schizophrenia. Neuroleptics can help manage symptoms of psychosis but may have side effects. Exposure therapy. Exposure therapy. Exposure therapy is a psychological treatment that involves gradual exposure to anxiety triggers to reduce fear. Exposure therapy has been highly effective for patients with phobias. Trauma-informed care. Trauma-informed care. This is an approach that recognizes and responds to the impact of trauma in patient care. Trauma-informed care ensures that the patient feels safe and respected in therapy. Somatic therapy. Somatic therapy. Somatic therapy is a therapeutic approach that focuses on the connection between mind and body in processing trauma. Somatic therapy techniques, like grounding exercises, help patients reconnect with their bodies. Psychosocial intervention. Psychosocial intervention. This is a non-medical approach to improving mental health through social and behavioral strategies. Group therapy is a common form of psychosocial intervention. Mindfulness meditation. Mindfulness meditation. This is a practice that involves focusing on the present moment to improve mental well-being. Mindfulness meditation is integrated into therapy to help manage stress and anxiety. Holistic psychiatry. Holistic psychiatry. This is an approach that combines conventional psychiatry with alternative and complementary methods. Holistic psychiatry considers lifestyle, diet, and emotional well-being alongside medication. Well done, you've just completed this lesson on 50 essential healthcare terms for mental health. Did you know that 80% of adults will experience back pain at some point in their lives, and that rehabilitation professionals, including physiotherapists, are in higher demand than ever? If you're preparing for the OET exam, working in rehabilitation, or simply looking to improve your medical English, mastering the right vocabulary is crucial. Hi, I'm Jer, and this is Learning English Pro, the channel where healthcare professionals like you excel in English and advance in their careers. Today, we're diving into 50 essential healthcare vocabulary terms, with a focus on physiotherapy, movement, and rehabilitation. This lesson comes from a student member request. And if you're a student member of Learning English Pro, your requests get priority. Plus, you'll get a handy downloadable guide with each lesson. The one for this lesson includes all the vocabulary from this lesson, fun exercises to test your knowledge, and links to additional medical English guides from Learning English Pro. If you want access to these exclusive materials, the link to join is in the video description. Alright, enough business. Let's get started with 50 key healthcare vocabulary terms for physiotherapy. We'll cover pronunciation, form, meaning, and context, just like a real Cambridge English lesson. Let's begin. First up, we're going to look at nouns relating to physiotherapy. And our first term is joint stability. Repeat after me. Joint stability. This term refers to the ability of a joint to maintain proper alignment during movement. Let's take a look at our example sentence. Joint stability is essential for athletes to prevent injuries during sports. Let's move on to our next term, which is muscle atrophy. Muscle atrophy. Muscle atrophy is the wasting away or decrease in muscle mass due to inactivity. Extended bed rest can lead to muscle atrophy, making rehabilitation more difficult. Tendinitis. Tendinitis. This is the inflammation of a tendon, often caused by repetitive motion. The runner developed tendinitis from overtraining without proper rest. Let's move on to myofascial release. Repeat after me. Myofascial release. This is a therapy technique used to relieve muscle tightness and pain. Myofascial release techniques can help reduce tension in tight muscles. Our next term is gait analysis. Gait analysis. This is the study of a person's walking pattern to detect abnormalities. Let's check out our sentence example. Gait analysis showed that the patient was favouring one leg after surgery. Our sixth noun is ergonomics. Ergonomics. Ergonomics is the science of designing workspaces to reduce strain and injury. Good ergonomics in the workplace can prevent chronic back pain. Prosthesis. Repeat after me. Prosthesis. A prosthesis is an artificial body part, such as a limb or joint replacement. After losing his leg in an accident, he was fitted with a prosthesis. Let's move on to orthotics. Orthotics. Orthotics are custom-designed inserts or devices to support and align the feet. She wears orthotics in her shoes to support her arches and prevent pain. Our next term is balance board. Balance board. A balance board is a tool used in therapy to improve stability and coordination. The therapist recommended using a balance board to improve coordination. Spinal alignment. Spinal alignment. This refers to the correct positioning of the spine to prevent pain and injury. Spinal alignment is crucial for reducing chronic back and neck pain. Compression bandage. Compression bandage. A compression bandage is a tight wrap used to reduce swelling and support injured areas. The doctor applied a compression bandage to control the swelling. Kinesiology tape. Kinesiology tape. This is a flexible tape used to support muscles and reduce pain. Kinesiology tape helps support the athlete's knee during recovery. Neuroplasticity. Neuroplasticity. This refers to the brain's ability to reorganize itself by forming new connections. Neuroplasticity allows stroke patients to regain lost motor functions. Our next term is TENS, which stands for transcutaneous electrical nerve stimulation. And this refers to a device that uses electrical impulses for pain relief. The patient uses a TENS machine to manage chronic pain in his lower back. Biomechanics. Biomechanics. Biomechanics is the study of human movement and mechanics. Let's look at our example sentence. Biomechanics helps us understand how different movements affect the body. Rehabilitation Center. Rehabilitation Center. This is a medical facility focused on recovery from injury or surgery. He spent 3 months in a rehabilitation center after his knee surgery. Soft tissue therapy. Soft tissue therapy. This is a treatment that involves manipulation of muscles and tendons. Soft tissue therapy reduced the tension in his shoulders and neck. Motor control. Motor control. Motor control is the ability to regulate and direct movement. Motor control exercises helped the patient regain movement in his arm. Let's move on to bursitis. Bursitis. This is an inflammation of the fluid-filled sacs that cushion joints. Bursitis in her shoulder made lifting heavy objects painful. Our 20th noun is the term scar tissue. Scar tissue. Scar tissue is thickened fibrous tissue that forms after an injury or surgery. Scar tissue formed after the surgery, affecting her range of motion. Well done, that's 20 nouns relating to physiotherapy and movement. And next up, we're going to take a look at some verbs relating to physiotherapy and movement, so get ready. All the definitions I give will be in the context of physiotherapy and movement. The first verb we will look at is mobilize. Mobilize. Mobilize means to move a joint or muscle to restore function. And let's take a look at our example sentence. The therapist mobilized the patient's stiff ankle to improve flexibility. Strengthen. Strengthen. Strengthen means to build up muscle power and endurance. Resistance exercises help strengthen weak muscles after an injury. Let's move on to retrain. Retrain. And this word means to teach a body part to function again after injury. The patient had to retrain his walking pattern after a stroke. Contract. Contract. As a verb, contract means to tighten a muscle actively. He was instructed to contract his abs during the exercise. Stabilize. Stabilize. In physiotherapy, to stabilize means to make steady or maintain proper alignment. Bracing techniques help stabilize her injured knee. Activate. Activate. This means to engage a muscle group during movement. The exercise activates the glutes and improves lower body strength. Realign. Realign. This word means to restore correct positioning of bones or joints. The chiropractor realigned his spine to relieve pressure on the nerves. Next up, we have elongate. Elongate. This word means to stretch or lengthen a muscle. Stretching helps elongate muscles and improve flexibility. Rehabilitate. Rehabilitate. This word means to restore strength and function after an injury. The clinic specializes in rehabilitating sports-related injuries. Engage. Engage. To engage means to actively use a muscle group. Engaging the core is crucial for proper posture during exercise. Next up, we have loosen. Loosen. And this means to reduce stiffness or tightness in muscles or joints. Massage therapy helped loosen tight muscles in his back. Reprogram. Reprogram. This means to train the nervous system to adapt to new movement patterns. Stroke patients need to reprogram their nervous system for movement recovery. Reinforce. Reinforce. This means to strengthen a movement or posture through repetition. The therapist reinforced proper walking techniques through repetition. Optimize. Optimize. To optimize means to improve efficiency and effectiveness in movement. Optimizing movement patterns can enhance athletic performance. Prevent. Prevent. To prevent means to take steps to avoid injury or deterioration. Wearing proper footwear can prevent ankle injuries. That's all the verbs we're going to cover. Next, let's move on to some adjectives relating to physiotherapy and movement. Our first adjective is weight-bearing. Weight-bearing. And this term describes something supporting body weight while standing or moving. Weight-bearing exercises strengthen bones and muscles. Our next term is the opposite of weight-bearing. Non-weight-bearing. Non-weight-bearing. This adjective can be used to describe an injured limb which has to avoid any pressure. After surgery, he was on a non-weight-bearing protocol for 6 weeks. Pain-free. Pain-free. We use this term to describe when one is without any discomfort or pain. She was relieved when her knee became pain-free after treatment. Progressive. Progressive. We use this term to describe when something like an injury or condition increases in difficulty or intensity over time. Let's check out our example sentence. The therapist used a progressive approach to increase exercise intensity. Isolated. Isolated. We use the term isolated when something like an exercise is targeting a specific muscle or movement. Isolated muscle exercises target specific weak areas. Controlled. Controlled. This term describes when something is done with precision and focus. Controlled movements help prevent injuries during rehabilitation. Unstable. Unstable. Unstable describes a situation or maybe a person's movement which is lacking balance or stability. An unstable surface forces the body to engage stabilizing muscles. Compensatory. Compensatory. Compensatory is used to describe situations where adjusting movements are made to make up for a weakness. Compensatory movements can indicate muscle imbalances. Inflamed. Inflamed. If something is inflamed, it is swollen and painful due to an irritation. Her wrist was inflamed after overuse at work. Restricted. Restricted. In physiotherapy, we can use restricted to describe a patient who is limited in movement or range of motion. The cast made her ankle movement restricted. Let's move on to optimal. Optimal. Optimal describes the best possible condition for function or recovery. The patient reached an optimal recovery state after months of therapy. Symmetrical. Symmetrical. Symmetrical is used to describe when conditions are even and balanced on both sides of the body. A symmetrical gait is important for proper walking mechanics. Overactive. Overactive. We use overactive to describe a person or perhaps muscles which are working excessively, often leading to strain. Overactive muscles can cause tightness and discomfort. And next we have the opposite of overactive. Underactive. Underactive. And similarly, this describes a person or maybe muscles which are not working enough, and it can lead to muscle weakness. An underactive glute can lead to poor hip stability. Our final adjective and final word for this lesson is resilient. Resilient. To be resilient is to be able to recover quickly and adapt to movement. A resilient mindset helps patients recover faster from injuries. Well done, you've just learned 50 essential healthcare vocabulary terms focused on physiotherapy, movement and rehabilitation, a huge step in improving your medical English. Student members, don't forget to download your guide packed with all the terms, exercises and links to additional resources. If you're not a member yet but want to access, click the link in the video description. In today's lesson, we'll explore 50 essential terms for healthcare with the focus on phlebotomy. Whether you're a nurse, doctor, or any healthcare professional, this lesson will help you communicate clearly and confidently in a medical setting. We'll go through each term just like a real Cambridge English lesson, covering pronunciation, word form, definition, and example sentences and context. Alright, let's get started with 50 essential phlebotomy terms for healthcare professionals. To start, let's cover some essential syringe-related terms. These are tools used in injections, blood draws, and sample collection. Understanding their names and functions will help you communicate clearly in a medical setting. Our first term is needle. Needle. Needle is a synonym which is commonly used interchangeably with syringe. Though technically, the needle is just one part. It is the sharp metal tip that penetrates the skin. Let's take a look at our example sentence. A 23-gauge needle is commonly used for blood collection. Let's move on to hypodermic syringe. Repeat after me. Hypodermic syringe. This is a syringe with a fine needle used for subcutaneous or intramuscular injections. Hypodermic syringes are commonly used for vaccines. Vacuum tube. Vacuum tube. A vacuum tube is used for blood collection, often instead of a traditional syringe. For venipuncture, we usually use a vacuum tube system. Auto-injector. Auto-injector. This is a device that administers a dose automatically without the need for manual injection. An epinephrine auto-injector is used for severe allergic reactions. Barrel. Barrel. The barrel is the cylindrical body of a syringe that holds the liquid. Check the barrel to ensure the correct dosage. Bevel. Bevel. This is the angled tip of the needle that facilitates smoother insertion. Insert the bevel facing up for a less painful injection. Hub. Hub. The hub is the base of the needle that attaches to the syringe. Twist the hub securely to attach the needle. Our next term is luer lock. Luer lock. And this is a type of syringe tip that allows the needle to be securely twisted on. Luer lock syringes help prevent accidental detachment of the needle. Slip tip. Slip tip. This is a simple push-on connection for needles. Slip-tip syringes allow quick and easy needle attachment. Safety cap. Safety cap. A safety cap is a protective cover for the needle to prevent accidental injuries. Always replace the safety cap before disposal. Now let's move on to key equipment and terms used in phlebotomy. From blood collection tubes to centrifuges, these are the tools and concepts every healthcare professional should know. Tourniquet. Tourniquet. A tourniquet is a band used to constrict blood flow to make veins more prominent. Apply the tourniquet about 3 inches above the puncture site. Venipuncture. Venipuncture. This is the process of inserting a needle into a vein to draw blood. Proper venipuncture technique reduces the risk of complications. Butterfly needle. Butterfly needle. This is a small needle with flexible tubing for delicate veins. Use a butterfly needle for patients with fragile veins. Lancet. Lancet. A lancet is a small, sharp tool used to puncture the skin for capillary blood collection. A lancet is commonly used for glucose testing. Vacutainer. Vacutainer. A vacutainer is a blood collection system that includes a tube, needle, and holder. Let's have a look at our example. Choose the correct vacutainer tube based on the required test. Centrifuge. Centrifuge. This is a machine used to separate blood components. Place the blood samples in the centrifuge for proper separation. Our next term is serum. Serum. Serum is the liquid portion of blood that remains after clotting. The lab requires a serum sample for the test. Plasma. Plasma. Plasma is the fluid part of blood that contains clotting factors. Unlike serum, plasma contains fibrinogen. Hematoma. Hematoma. A hematoma is a localized collection of blood outside blood vessels. A hematoma may form if pressure is not applied correctly. Capillary. Capillary. This is a tiny blood vessel where blood is collected from the finger or heel. Capillary blood is often used for rapid glucose testing. Anticoagulant. Anticoagulant. An anticoagulant is a substance that prevents blood clotting. Heparin is an anticoagulant used in certain blood tests. Hemolysis. Hemolysis. This is the breakdown of red blood cells, which can often affect test results. Avoid shaking the tube forcibly to prevent hemolysis. Needle stick injury. Needle stick injury. This is an accidental puncture by a used needle. Report any needle stick injury immediately to the supervisor. Gauge. Gauge. Gauge is the thickness of a needle. Smaller numbers indicate a larger needle. A 21 gauge needle is commonly used for routine blood draws. Evacuated tube. Evacuated tube. A vacuum-sealed container used for blood collection. Select the appropriate evacuated tube based on the test ordered. Phlebotomy isn't just about equipment, it's about actions. In this section, we'll focus on important verbs used during blood collection and handling, ensuring you understand the correct terminology for each step of the procedure. Palpate. Palpate. To palpate is to feel with the hands, in this case, to locate veins. Always palpate the vein before inserting the needle. Anchor. Anchor. This verb means to hold the vein steady before puncture. Use your non-dominant hand to anchor the vein. Insert. Insert. This means to introduce the needle into the vein. Gently insert the needle at a 15-degree angle. Withdraw. Withdraw. Withdraw means to remove the needle from the vein. Slowly withdraw the needle once blood collection is complete. Invert. Invert. This means to gently mix blood with the additive in the tube. Invert the tube 5 to 10 times to ensure proper mixing. Label. Label. To label means to mark the blood sample with patient details. Always label the sample immediately after collection. Dispose. Dispose. To dispose means to discard needles and biohazardous waste safely. Dispose of used needles in the sharps container. Recollect. Recollect. This means to draw blood again if the first sample is inadequate. A hemolyzed sample may require you to recollect the blood. Aspirate. Aspirate. In this case, aspirate means to pull back on the syringe to check for blood return. Never aspirate when using a vacuum collection system. Apply. Apply. And this means to place pressure or a bandage on the puncture site. Apply firm pressure to prevent bruising. To describe veins, needles, and blood samples accurately, you need the right adjectives. This section will help you use precise language when assessing patients and handling samples. Our first adjective is fragile. Fragile. And this describes something which is easily damaged, often used to describe veins. Let's take a look at our example. Elderly patients often have fragile veins. Superficial. Superficial. This describes something located near the surface, like a vein, making it easier to access. Use a superficial vein for easier blood collection. Deep. Deep. This describes a vein which is situated far below the skin's surface. Some patients have deep veins that require ultrasound guidance. Next up, we have clotted. Clotted. Clotted describes blood that has solidified. A clotted sample cannot be used for a coagulation test. Sterile. Sterile. If something is sterile, it is free from bacteria or contamination. Always use a sterile needle for venipuncture. Finally, let's look at common phrases used in phlebotomy. These collocations are essential for giving instructions, explaining procedures, and ensuring smooth communication with patients and colleagues. Locate a vein. Locate a vein. This means to identify a suitable vein for venipuncture. Use a warm compress to help locate a vein in difficult cases. Confirm patient identity. Confirm patient identity. And of course, this means to verify the patient's details before drawing blood. Always confirm patient identity before collecting a sample. Apply a tourniquet. Apply a tourniquet. And this means to restrict blood flow and make veins more visible. Apply a tourniquet for no longer than 1 minute. Insert the needle. Insert the needle. And this means to puncture the vein with the needle. Slowly insert the needle at the correct angle. Draw blood. Draw blood. This common phrase means to collect a blood sample. Use the correct technique to draw blood efficiently. Remove the tourniquet. Remove the tourniquet. This means to release the restriction after blood flow is established. Remove the tourniquet before withdrawing the needle. Prevent hemolysis. Prevent hemolysis. And this means to prevent breaking red blood cells. Handle the sample carefully to prevent hemolysis. Dispose of sharps. Dispose of sharps. This phrase means to safely discard needles and other sharp instruments. Always dispose of sharps in designated containers. Fill the tube. Fill the tube. This means to allow blood to flow into the collection tube. Hold the tube at an angle to fill the tube correctly. Check for bleeding. Check for bleeding. And this final phrase means to ensure the puncture site is still not bleeding. After removing the needle, check for bleeding and apply pressure. That was a serious upgrade to your vocabulary. Now let's keep going. Up next, we have 100 new phrases for nurses. Fresh, practical, modern English you can start using immediately. If you're finding this helpful, make sure to hit the subscribe button and join the mission to support nurses around the world. Did you know that over 80% of medical errors result from miscommunication? For nurses, clear and confident English isn't just helpful, it's essential. Hi, I'm Jer and this is Learning English Pro, the channel where healthcare professionals like you come to excel in English and advance in your careers. Today, we're diving into 100 brand new English phrases for nurses, covering everything from patient care and modern healthcare challenges to digital communication and mental health support. These aren't just any phrases, they reflect real-world nursing situations, helping you sound professional and natural in English. There are two ways to enjoy this lesson. If you're an active learner, select the topic of your choice from the timestamps in the video description. Grab a pen and paper and think about how you can incorporate these English phrases into your everyday work. Maybe you're a passive listener, so put this lesson on in the background and go about your day. This is a great way to pick up listening on the go and engage your natural listening skills. Okay, let's get started on our lesson. Our first topic is welcoming and initial assessment. Let's get you checked in. Do you have your insurance card with you? With this phrase, we are welcoming the patient and ensuring that all necessary documentation is in place before proceeding with their care. Can you verify your personal information for me? Here we are confirming the patient's details to ensure that their medical records are accurate and up to date. Do you have any recent travel history? This question is used to assess whether the patient has been in areas with potential health risks, such as infectious disease outbreaks. Have you been exposed to any contagious illnesses recently? By asking this, we are screening the patient for possible exposure to illnesses that may require special precautions. What concerns would you like to discuss today? This phrase invites the patient to share their main reason for seeking medical care, ensuring their needs are addressed properly. Are you experiencing any unusual symptoms? With this question, we encourage the patient to describe anything out of the ordinary that could assist in diagnosing their condition. Do you have any mobility issues I should be aware of? This helps us determine whether the patient requires special assistance or adjustments to their care plan. Have you recently undergone any medical procedures? Here we are checking for any recent surgeries or treatments that might be relevant to their current condition. Do you have any cultural or religious preferences we should consider in your care? This phrase acknowledges the patient's personal values, ensuring that their cultural and religious needs are respected. Have you received your latest vaccinations? By asking this, we verify whether the patient is up to date on important immunizations, which can be crucial for their health. Let's move on to the next topic, which is taking vital signs and monitoring. I'm going to check your blood sugar levels now. This informs the patient that a glucose test will be performed, which is especially important for diabetic care. Let me place this pulse oximeter on your finger. Here we are letting the patient know that we will be measuring their oxygen saturation levels using a small device. Your oxygen levels are slightly low. Let's monitor them closely. With this statement, we reassure the patient that we are keeping a close eye on their respiratory function. I need to take your respiratory rate. This informs the patient that we will be measuring how many breaths they take per minute, an important indicator of lung health. Your heart rate is irregular. I'll inform the doctor. By saying this, we acknowledge an unusual finding and ensure the patient that their case will be escalated to a physician. I'll take another reading in a few minutes to confirm. This reassures the patient that any unusual readings will be double-checked for accuracy. Let's check your hydration levels. This phrase lets the patient know that we will assess whether they are adequately hydrated, which is crucial for their overall health. I'm monitoring you for any signs of dehydration. Here we explain that we are paying attention to symptoms such as dry skin or dizziness that may indicate fluid loss. Let me check your pupil response to light. This informs the patient that we are performing a neurological check to assess their brain function. I'll need to perform a quick neurological assessment. With this phrase, we prepare the patient for a simple set of tests that will evaluate their nervous system. Our third topic is modern medication and pain management. We'll start with the non-opioid pain relief option. Here we explain that the first line of treatment will be a pain reliever that does not contain opioids, reducing the risk of dependence. This medication is part of an updated treatment plan. By saying this, we clarify that the patient's treatment has been adjusted for better effectiveness. Have you taken any over-the-counter medications today? This question helps us determine whether the patient has already taken something that might interact with their prescribed medication. We're switching your medication due to potential interactions. Here we explain that a change has been made to avoid harmful drug interactions. This is a long-acting pain reliever. With this phrase, we let the patient know that their medication is designed to provide relief over an extended period. We'll monitor for any potential allergic reactions. This reassures the patient that we will be observing them for any signs of an allergic response. Let me explain the potential side effects. By saying this, we ensure that the patient understands any possible effects the medication may have on their body. This antibiotic course must be fully completed. Here we emphasize the importance of finishing the entire course to prevent antibiotic resistance. We're moving to an IV antibiotic to treat the infection faster. This phrase informs the patient that a strong form of treatment is being administered directly into their bloodstream. I'll adjust your medication schedule based on your response. By saying this, we reassure the patient that their treatment plan will be tailored to how their body reacts. That's already 30 phrases you have mastered. Well done. Let's move on to our fourth topic, which is patient-centered care. We practice a patient-first approach to healthcare. This statement reassures the patient that their needs and comfort are our top priorities. Would you like me to explain your treatment options? With this phrase, we offer to provide clarity on the available medical choices. Let's discuss your care plan together. This invites the patient to be an active participant in their treatment decisions. Is there anything you're feeling anxious about? By asking this, we give the patient space to express any worries they may have about their condition or treatment. Would you prefer a private room if available? This offers the patient the option of increased privacy during their hospital stay. Do you have any dietary restrictions we should be aware of? With this question, we ensure that the patient's meals align with their medical needs, allergies, or cultural preferences. Let's go over your daily activity goals. Here we are helping the patient set realistic movement and exercise goals that support their recovery. I'll make sure you're as comfortable as possible. This phrase reassures the patient that we are attentive to their well-being and comfort throughout their stay. Would you like me to contact your family member? By offering this, we acknowledge the importance of keeping loved ones informed and involved in the patient's care. You have the right to ask questions at any time. This statement empowers the patient by reminding them that they are encouraged to seek clarity about their treatment. Let's move on to our next section, which is phrases for mental health and emotional support. I'm here to listen if you need to talk. With this phrase, we offer emotional support and let the patient know they are not alone in their concerns. Would you like a quiet space to relax for a moment? This phrase acknowledges that the patient may feel overwhelmed and offers them a calming environment. We have mental health resources available for you. By mentioning this, we remind the patient that professional support is accessible if needed. It's okay to feel overwhelmed. Let's take it one step at a time. Here, we normalize the patient's emotions and encourage a manageable approach to their concerns. I can connect you with a counsellor if needed. This phrase offers the patient an additional level of psychological support if they wish to speak to a professional. Are you experiencing any stress-related symptoms? With this question, we help identify whether the patient's physical symptoms might be linked to emotional stress. How are you coping with your diagnosis? Here, we check in on the patient's emotional response to their medical condition and treatment. Would you like some breathing exercises to help with anxiety? This offers the patient a practical method to manage feelings of stress or panic. Let's check in on your emotional well-being. With this phrase, we emphasize that mental health is just as important as physical health. You're not alone. We're here to support you. This statement provides reassurance and reminds the patient that they have a team caring for them. We are now over halfway through our list, and our next topic is technology in nursing and digital health. We'll input your information into our digital health system. This phrase lets the patient know that their records will be stored securely in an electronic format. You can access your records through our patient portal. Here, we inform the patient that they can review their medical history and results online. Would you like a digital copy of your discharge instructions? This question offers the patient a more convenient way to keep track of their post-care guidelines. Let's scan your wristband to verify your medication. This explains that their identification will be checked electronically to prevent medication errors. We're using telemedicine for specialist consultations. With this statement, we introduce the patient to remote healthcare services for added convenience. I'll document your symptoms in real time for the doctor. This phrase reassures the patient that their symptoms are being recorded promptly for medical review. Our system will alert us if there are any medication conflicts. Here we explain that technology is being used to prevent harmful drug interactions. We have remote monitoring options available. This informs the patient that they may be able to track their health from home using medical technology. You can track your recovery progress using the app. With this phrase, we introduce the patient to digital tools that can help them manage their health. Your electronic health records will be updated immediately. This statement reassures the patient that their information is kept current and accurate. Our next topic is really important and relates to phrases for handling modern health crises. We are currently following pandemic safety protocols. With this phrase, we explain that special procedures are in place due to an ongoing health crisis. Let me explain the new infection control measures. Here, we inform the patient about updated hospital safety procedures. Please keep your mask on while we assess you. This phrase reminds the patient of protective measures to prevent the spread of infections. You'll be placed in an isolation room as a precaution. By saying this, we reassure the patient that isolation is a protective measure, not a punishment. This is a high-risk unit, so extra precautions are required. With this phrase, we help the patient understand why certain safety measures are necessary. We need to screen you for flu-like symptoms. This informs the patient that routine symptom checks are required during certain outbreaks. This area is for COVID-19 testing. Here, we provide clear instructions about designated testing locations. We're implementing a new antibiotic stewardship program. This phrase explains that antibiotics are being carefully managed to prevent resistance. This vaccine is recommended based on your health history. With this statement, we help the patient understand why they may need an immunization. Let's make sure you're up to date on your boosters. This phrase reminds the patient about the importance of staying protected against preventable diseases. You have already mastered 70 phrases. Well done. Let's move on to our next topic, which is dealing with difficult situations. I understand this is a frustrating situation. I'll do my best to help. With this phrase, we acknowledge the patient's frustration while reassuring them that we are working to resolve the issue. We're experiencing high patient volumes, but I assure you we'll take care of you. This statement provides reassurance while managing expectations about potential wait times. Let's go step by step to address your concerns. Here, we encourage the patient to work through an issue with us in a calm and structured way. I'm sorry for the wait. Let me check on the doctor's availability. By saying this, we apologize for delays and show that we are actively working to get the patient seen. I know this isn't easy. Let me explain what happens next. This phrase validates the patient's feelings while helping them understand the next steps. I hear your concerns, and I will escalate this if necessary. Here, we acknowledge the patient's worries and assure them that their issue will be addressed at a higher level if needed. We're doing everything possible to get you seen quickly. This reassures the patient that their care is a priority, even in a busy healthcare setting. Let's focus on solutions together. With this phrase, we encourage a collaborative approach to resolving the patient's concerns. I'll ensure your concerns are addressed before you leave. This statement reassures the patient that they won't be discharged without a proper resolution. I understand this is overwhelming. You're in good hands. By saying this, we provide comfort and assurance to a patient who may be feeling anxious. Our penultimate topic relates to phrases for patient discharge and home care. Your discharge process is almost complete. With this phrase, we inform the patient that they will soon be ready to leave the facility. Would you like a summary of today's procedures? Here, we offer the patient a quick overview of everything that has been done during their visit. Let's schedule a follow-up appointment. This statement ensures that the patient has a plan in place for continued care. Do you have someone to assist you at home? With this question, we check if the patient has a support system for their recovery. We recommend you take it easy for the next few days. This phrase advises the patient to rest and avoid strenuous activity after treatment. I'll review your home care instructions with you. Here, we take the time to explain the patient's recovery steps and self-care responsibilities. Let me know if you have any transportation concerns. With this phrase, we check if the patient needs assistance getting home safely. You'll need to check in with your primary care provider. This statement reminds the patient to follow up with their regular doctor after discharge. This wound will need daily care at home. Here we instruct the patient on how to manage their wound properly. Make sure to complete your full recovery plan. This phrase emphasizes the importance of following all post-discharge recommendations. And finally, we are on our last topic, which covers phrases relating to nursing team communication. I'll hand over your case to the night shift nurse. With this statement, we inform the patient that their care will be continued by another professional. Let me update the team on your progress. Here, we ensure that all healthcare providers involved are kept informed about the patient's condition. I'm documenting all updates in your file. This phrase reassures the patients that their medical records are being kept current. We'll be doing hourly rounds to check on you. By saying this, we let the patient know that they will receive regular monitoring. Our team works closely with specialists for the best care. This phrase highlights the collaborative approach of healthcare professionals in treating the patient. Let's collaborate to ensure the best outcome. Here we emphasize teamwork in making decisions about the patient's care. I'll confirm the latest treatment plan with the attending physician. This reassures the patient that their treatment is being reviewed by the doctor. We have a care team meeting later today. With this phrase, we inform the patient that their case will be discussed among the healthcare team. Let's reassess your pain management strategy. Here, we check if any adjustments are needed to improve the patient's comfort. Your nursing team is here 24/7 to support you. With our final phrase, we are reassuring the patient that they are never alone and that help is always available. You're doing incredible work. Now let's move into one of the most human parts of nursing, patient care. These next 100 phrases are all about connection, reassurance, and day-to-day communication. And don't forget, you can access this full guide plus 200 lessons in the student membership. In this lesson, you will learn 100 English phrases for patient care. This is great for nurses and other healthcare workers. In the world of healthcare, the quality of patient care is paramount. Whether you are a nurse, caregiver, or healthcare assistant, the way you interact with patients can significantly impact their overall experience and recovery. In this lesson, we will explore key phrases and techniques that are essential for providing excellent patient care. We'll cover a range of topics, including morning activities, bathing and bathroom, toilet assistance, emotional support, encouraging mobility and exercise, communication with family, and transitioning care. Each section will provide you with practical sentences and tips to improve your communication and caregiving skills. By mastering these key phrases, you'll be better equipped to create a positive and supportive environment for your patients. So if you're ready, let's get started and make a difference in the lives of our patients with compassionate and effective care. Our first topic is morning activities. Good morning, how are you today? Good morning, how are you today? Hello, I'm Jer, your nurse for today. Hello, I'm Jer, your nurse for today. Hi there, nice to see you again. Hi there, nice to see you again. How did you sleep last night? How did you sleep last night? I hope you had a restful night. I hope you had a restful night. Would you like help getting dressed? Would you like help getting dressed? What would you like to wear today? What would you like to wear today? Let's get you into some fresh clothes. Let's get you into some fresh clothes. Can I assist you with your shoes? Can I assist you with your shoes? Do you need help with your buttons? Do you need help with your buttons? Let's move on to our next topic, which are phrases for bathing and the bathroom. Would you like a bath now? Would you like a bath now? I'll help you get to the bathroom. I'll help you get to the bathroom. Do you need assistance with your bath? Do you need assistance with your bath? Let's get you freshened up. Let's get you freshened up. I'll help you with your hygiene needs. I'll help you with your hygiene needs. Is the water temperature okay? Is the water temperature okay? Do you need help getting in or out of the tub? Do you need help getting in or out of the tub? Would you prefer a shower instead? Would you prefer a shower instead? I'll assist you with washing. I'll assist you with washing. Let's make sure you're comfortable and clean. Let's make sure you're comfortable and clean. Next up, we have some English phrases you might use to help a patient to use the toilet. Do you need to use the bathroom? Do you need to use the bathroom? I can help you get to the toilet. I can help you get to the toilet. Let's take a trip to the bathroom. Let's take a trip to the bathroom. Do you need assistance with your clothing? Do you need assistance with your clothing? I'll be here if you need help. I'll be here if you need help. Would you like some privacy while you use the toilet? Would you like some privacy while you use the toilet? I'll help you wash your hands afterward. I'll help you wash your hands afterward. Let's make sure you're comfortable on the toilet. Let's make sure you're comfortable on the toilet. Do you need help getting up? Do you need help getting up? I'll assist you back to your bed or chair. I'll assist you back to your bed or chair. Well done, you're doing great. You've already learned 30 English phrases. Next up, we have English phrases relating to giving medication to a patient. It's time for your medication. It's time for your medication. Have you taken this medication before? Have you taken this medication before? Do you have any allergies? Do you have any allergies? Let's take your pills with some water. Let's take your pills with some water. This is your medication for today. You could add in the name of the medication here. This is your aspirin for today. I'll check on you after you take your meds. I'll check on you after you take your meds. Let me explain what this is for. Let me explain what this is for. Please let me know if you feel any side effects. Please let me know if you feel any side effects. Remember to take this with food. Remember to take this with food. Do you need a reminder for your next dose? Do you need a reminder for your next dose? Our next topic is phrases related to meals and feeding. It's time for breakfast. It's time for lunch. It's time for dinner. Can I help you with your meal? Can I help you with your meal? What would you like to eat today? What would you like to eat today? Do you have any dietary restrictions? Do you have any dietary restrictions? Let's make sure you're getting enough nutrients. Let's make sure you're getting enough nutrients. Would you like some water or juice? Would you like some water or juice? Are you enjoying your meal? Are you enjoying your meal? Can I help you with your utensils? Can I help you with your utensils? Let me know if you need more to eat. Let me know if you need more to eat. I'll check back in a bit to see how you're doing. I'll check back in a bit to see how you're doing. Our next topic covers phrases related to helping patients with their feelings, emotional support. How are you feeling today? How are you feeling today? Would you like to talk about anything? Would you like to talk about anything? I'm here to listen if you need to talk. I'm here to listen if you need to talk. It's okay to feel the way you do. It's okay to feel the way you do. How can I make things better for you? How can I make things better for you? You're doing a great job. You're doing a great job. Let me know if you need some quiet time. Let me know if you need some quiet time. Would you like to speak with a counselor? Would you like to speak with a counselor? I'm here to support you. I'm here to support you. Take your time. I'm here for you. Take your time. I'm here for you. These phrases are going to be very useful to any nurse or healthcare worker. Next up, let's take a look at some conversation starters. These phrases are really useful when you want to get to know your patient a bit better. What's your favorite book? What's your favorite book? Do you enjoy any hobbies? Do you enjoy any hobbies? Tell me about your family. Tell me about your family. What kind of music do you like? What kind of music do you like? Have you travelled much? Have you travelled much? What's your favourite movie? What's your favourite movie? Do you have any pets? Do you have any pets? What was your profession? What was your profession? Tell me about your childhood. Tell me about your childhood. Do you have any favourite recipes? Do you have any favourite recipes? We are certainly working our way through our 100 English phrases for patient care. Our next topic is encouraging mobility and exercise. Let's go for a short walk. Let's go for a short walk. Would you like to do some stretches? Would you like to do some stretches? It's important to stay active. It's important to stay active. Can I help you with some exercises? Can I help you with some exercises? How about a walk around the hall? How about a walk around the hall? Let's do some gentle movements. Let's do some gentle movements. Do you feel up to some physical activity? Do you feel up to some physical activity? I'll assist you with your exercises. I'll assist you with your exercises. Let's work on your strength and mobility. Let's work on your strength and mobility. We can take it slow and steady. We can take it slow and steady. Our ninth topic is communication with family. Would you like to call your family? Would you like to call your family? Can I help you video chat with your loved ones? Can I help you video chat with your loved ones? Do you want me to update your family on your condition? Do you want me to update your family on your condition? Is there a family member you'd like to speak with? Is there a family member you'd like to speak with? I can assist with arranging a visit. I can assist with arranging a visit. Let's keep your family informed. Let's keep your family informed. Would you like to write a letter or email? Would you like to write a letter or email? I can help you send a message. I can help you send a message. Is there anything you want me to tell your family? Is there anything you want me to tell your family? I'll make sure your family knows how you're doing. I'll make sure your family knows how you're doing. And now we are at our final topic. In this segment, we'll learn phrases for communicating about the end of our shift and transitioning care to another nurse or healthcare worker. My shift is ending soon. My shift is ending soon. I'll introduce you to the next nurse. I'll introduce you to the next nurse. Is there anything you need before I go? Is there anything you need before I go? I've informed the next nurse about your needs. I've informed the next nurse about your needs. I hope you have a restful night. I hope you have a restful night. I'll be back to check on you tomorrow. I'll be back to check on you tomorrow. Thank you for allowing me to care for you. Thank you for allowing me to care for you. I'll make sure the next nurse knows your preferences. I'll make sure the next nurse knows your preferences. Please let the night nurse know if you need anything. Please let the night nurse know if you need anything. It's been a pleasure taking care of you. It's been a pleasure taking care of you. Well done, you've just learned 100 English phrases for nurses and healthcare workers for patient care. You've done a fantastic job. Those phrases are essential for quality care and empathy. Now let's shift to emergencies, language that needs to be clear, fast and life-saving. If this lesson is helping you, drop me a comment and tell me where you're working. I'd love to hear from you. Today's lesson is 100 English phrases for nurses in emergency situations. In this video, I'll walk you through key phrases you need to communicate effectively in high-pressure medical settings, whether you're triaging patients, stabilizing them, or working with your medical team. In an emergency, one of the first things a nurse must do is assess the severity of a patient's condition. These phrases will help you triage patients quickly and efficiently. What is your name and date of birth? You can use this question to establish basic patient information. What seems to be the problem? This is a direct way to ask the patient why they're seeking emergency care. Are you in any pain right now? Where does it hurt? This phrase can be important for identifying areas of pain. On a scale of 1 to 10, how severe is your pain? We say this to assess the intensity of pain, which helps to prioritize treatment. When did the symptoms start? Knowing the timeline is crucial for diagnosing the urgency of the condition. Is this the first time this has happened? This helps understand if it's a recurring issue or a new event. Are you allergic to any medications? Allergies are considered critical information when planning treatment. Are you taking any medications currently? This question helps avoid drug interactions during treatment. Have you experienced this kind of pain before? Identifying patterns can assist with diagnosis. I'm going to take your vital signs. This is basic communication when starting an initial assessment. Once the assessment is complete, stabilizing the patient is the next critical step. Here are key phrases for communicating with the patient and team during stabilization. I'm going to give you some oxygen to help with your breathing. We need to start an IV to administer fluids. We need to start an IV to administer medications. Please stay still while we put on the neck brace. This phrase is useful when dealing with spinal injuries or trauma patients. I'm going to elevate your legs to improve blood flow. You're doing great. Try to take slow, deep breaths. This phrase is great for offering reassurance to a panicked patient. We need to monitor your heart rate closely. I'm going to check your blood pressure now. Let us know if the pain gets worse. This phrase encourages communication about any changes in pain levels. We're going to move you to a more comfortable position. This phrase can help keep the patient calm during movement. Stay with us, you're in good hands. This phrase can offer emotional support during a critical moment. Clear communication with the medical team is essential to providing effective care. Here are phrases that nurses use to communicate with doctors and other healthcare professionals in emergency situations. The patient is experiencing severe chest pain. We need to order an urgent EKG. The patient is hypotensive. Blood pressure is 85/50. We're prepping the patient for intubation. Could you assist with starting the IV? I've administered 2 milligrams of morphine for pain. The patient has a history of asthma. We need to monitor their breathing closely. Can we arrange for a portable X-ray? The patient's oxygen saturation is dropping. Let's get the crash cart ready just in case. In cases of cardiac arrest, fast and clear communication is vital. These phrases are useful for communicating with your team when a patient's heart stops. We have a code blue in room 3. This is the emergency alert for cardiac arrest. Begin CPR immediately. Get the defibrillator. Charging to 200 joules. Clear. Check for a pulse. Administer epinephrine 1 mg. Continue chest compressions. Switch every 2 minutes. I'm going to secure the airway. Let's check the heart rhythm again. We have a pulse. When a patient is struggling to breathe, nurses need to act quickly and communicate clearly. These phrases will help you manage respiratory distress. I'm going to put you on oxygen to help your breathing. We can say this phrase to offer reassurance to the patient while applying oxygen. Take slow, deep breaths for me. With this phrase, we are coaching the patient to control their breathing. I'm going to check your oxygen levels now. It's important to keep the patient informed. We need to start nebulizer treatment. Let me know if it's harder to breathe. I'm adjusting the oxygen flow rate. We need to prepare for intubation. I'm going to take a blood gas sample. A blood gas sample is used to assess the patient's oxygen and carbon dioxide levels. The patient is cyanotic. We need to act quickly. Cyanotic is the blue discoloration on skin due to lack of oxygen. We're getting you into a comfortable position to help your breathing. You can use this phrase with a patient to let them know you're repositioning them to alleviate distress. Trauma patients require quick thinking and clear instructions. These are key phrases for managing traumatic injuries. Where does it hurt the most? We use this question for identifying the primary site of trauma. We need to stabilize the fracture before moving. I'm applying pressure to the wound to stop bleeding. By using this phrase, you are communicating the wound care steps. We're going to roll you over carefully. With this phrase, you're preparing a patient for movement. We need to immobilize the neck to prevent further injury. This phrase is useful for when you're dealing with a spinal trauma. The patient is losing a lot of blood. Let's start a transfusion. This is something you might say to a colleague to initiate the life-saving treatment. I'm going to apply a tourniquet. A tourniquet can be used in cases of severe bleeding. We need to monitor for signs of shock. Is there any numbness or tingling in your limbs? This question to a patient can help identify nerve damage. We'll be taking you for an X-ray to check for fractures. During emergencies, nurses often need to communicate with family members who are anxious or frightened. It's important to be clear, calm, and compassionate when delivering updates. Your loved one is stable at the moment, and we are closely monitoring their condition. This phrase offers reassurance to family members while giving them an update. We're doing everything we can to help them. With this phrase, you're offering comfort during critical moments. It's a critical situation, but they are receiving the best possible care. This is a balanced way to acknowledge the seriousness of a situation while offering reassurance. We will let you know as soon as there's any change in their condition. This is letting the family know that they'll be informed of updates. I understand this is very difficult, and I'm here to answer any questions you may have. With this phrase, you're providing emotional support and encouraging dialogue. The doctor will speak with you shortly to give you a more detailed update. They are responding well to the treatment so far. With this phrase, you are sharing positive news. We are going to run some tests to better understand their condition. Please wait here and I'll come back with more information as soon as I have it. With this phrase, you're guiding the family on where to stay during the process. I know this is overwhelming, but we are doing everything we can. With this phrase, you're acknowledging the family's emotions while offering reassurance. Administering medications and managing IVs is a critical part of emergency care. It's important for nurses to explain these procedures clearly directly to patients. I'm going to start an IV to give you fluids. I'm going to start an IV to give you medication. This medication should help ease your pain. We're going to give you some antibiotics through the IV. Please keep your arm still while I insert the needle. Let me know if you feel any discomfort. The IV fluids will help stabilize your condition. I'm administering the pain relief now, and it should start working shortly. Can I check your IV site to make sure everything looks good? I'm going to switch your IV to a different medication. You may feel a bit of a sting. Let me know if it becomes painful. Nurses may encounter patients in mental health crises, requiring them to de-escalate situations and provide calm reassurance. Here are essential phrases to handle these sensitive scenarios. You're safe here. We're here to help you. With this phrase, you're reassuring the patient that they are in a safe environment. Can you tell me how you're feeling right now? In a difficult situation, it's important to open up communication to better understand the patient's mental state. Try to take some deep breaths and focus on calming down. With this sentence, you're guiding the patient through calming techniques. I understand that you're upset, but we need to work together to help you feel better. With this phrase, we're acknowledging the patient's emotions while offering a path forward. We're going to do our best to make you feel comfortable. This phrase is great for offering support and reassurance. Is there anyone you'd like to talk to or contact? It's important to provide the option for the patient to reach out to someone. I'm going to stay with you until things feel more manageable. With this phrase, you're offering your physical presence for reassurance. Would you like to tell me what's been bothering you? With this question, you're encouraging the patient to open up about their feelings. We're here to listen and support you. You're not alone. With this sentence, you're providing emotional support and validation. Let's focus on getting you the help you need. This positive phrase helps by directing the patient's attention towards positive actions. After an emergency situation has stabilized, nurses often need to provide aftercare and discharge instructions to patients. These phrases will help you guide patients through the next steps. You're stable now, but we'll need to keep monitoring you for a little longer. This phrase helps explain the need for continued observation. You'll need to rest and follow these instructions carefully once you're home. This phrase outlines post-discharge care. Please take these medications as prescribed and let us know if you experience any side effects. With this phrase, you're providing medication guidance and support. Here's a follow-up appointment for you to check in with your doctor. It's important to schedule the patient for the next steps in care. Avoid heavy lifting or strenuous activity for the next few days. This is common discharge advice for certain conditions. You can go home once the doctor clears you. With this phrase, you're letting the patient know what to expect before discharge. If you experience any of these symptoms again, come back immediately. This statement provides emergency readmittance instructions. We'll give you a summary of your treatment and instructions to take home. This phrase covers explaining post-care paperwork. Make sure you drink plenty of fluids and get lots of rest. This phrase offers more basic aftercare tips. You're all set. Take care and let us know if you need anything. This phrase can be your final discharge communication with a patient. And that's it for today's lesson on 100 key phrases for nurses in emergency situations. That was high-stress communication. Well done. Next up, we have a huge lesson, medicine and pharmacy phrases for giving safe, accurate medication instructions. The full printable guide is available right now in the YouTube store, or it comes with my student membership. With studies showing that language barriers can lead to medication errors and patient harm. If you're a healthcare professional, mastering pharmacy English is essential to providing safe, effective care. Welcome to Learning English Pro, the channel for healthcare professionals like you to excel at medical English and advance your careers. I'm Jer, and today you're joining me for the Pharmacy English Masterclass, your ultimate guide to the language of pharmacies. Let's get started with the first lesson in our masterclass, Pharma 101, where we'll dive into the foundational terms of the pharmaceutical industry. With this lesson, I want to challenge you. So far in this masterclass lesson, you've learned hundreds of English phrases for nurses, but now it's your turn. The next section covers vocabulary related to the pharmaceutical industry. For each of the terms, I will display a phrase on screen, but I won't be saying it. In this lesson, your challenge is to say the phrase yourself. Pause the video and have a go. This is a great way to practice some of the skills you've already picked up in this masterclass lesson. Good luck. If you're new to this field, you're in the right place. We'll be exploring 15 essential terms with more detailed definitions to get you started. The pharmaceutical industry is a vast sector responsible for researching, developing, manufacturing, and distributing medications that improve human health and well-being. We also have the term pharma, which is a commonly used abbreviation of the word pharmaceutical. This term is often used informally to describe the entire pharmaceutical field and is frequently used in discussions and news related to the industry. Let's take a closer look at this word medication. A medication is a substance used for medical treatment, such as pills, capsules, or syrups. Medications can treat a wide range of conditions, from pain relief to chronic diseases. With this industry, you'll hear a lot about drug discovery. This is the intricate process of identifying and designing new medications through research and experimentation. This includes the initial identification of potential compounds to extensive laboratory testing. Clinical trials are carefully designed experiments to test the safety and efficacy of new drugs before they are approved for use. These trials involve multiple phases and help determine whether a drug is safe and effective. Let's Let's move on to our next bit of terminology, which is prescription drug. A prescription drug is a medication that can only be obtained with a doctor's written order. They are typically used for serious medical conditions and require professional guidance. There is also over-the-counter medication, which is available without a prescription and can be purchased directly from a pharmacy or store. These are generally for common self-treatable ailments. Another type of medication you'll hear about is a vaccine. A vaccine is a substance that stimulates the immune system to protect against specific diseases. Vaccines have been instrumental in preventing and controlling infectious diseases like polio and measles. Drug regulatory authorities are responsible for ensuring the safety and effectiveness of drugs. They review and approve medications before they reach the market. And on screen for you, you can see a selection of these authorities from different English-speaking countries. Probably the most widely known of these would be the FDA in the United States. A pharmaceutical company is an organization that researches, develops, and manufactures medications. These companies range from small research-focused firms to large global corporations. A generic drug is a medication that is equivalent to a brand name drug, but is usually more affordable. They contain the same active ingredients and meet the same quality standards. The term biotechnology involves using living organisms and biological systems to develop new drugs and treatments. This field has led to the creation of therapies like biologic drugs. Clinical data refers to information gathered during clinical trials, helping to assess a drug's effectiveness. It includes data on patient demographics, safety, efficacy, and adverse reactions. Adverse reactions are more commonly known as side effects. These are unintended and often unwanted effects of a medication, which may happen in addition to its intended effects. Understanding potential side effects is crucial for safe medication use. A placebo is a substance with no therapeutic effect. It is used in clinical trials as a control to compare with the effects of the drug being tested. Placebos help researchers assess the true impact of a medication. Pharmacovigilance is the science and activities related to the detection, assessment, understanding, and prevention of adverse effects or any other drug-related issues. It plays a key role in ensuring medication safety even after a drug is on the market. Today we're diving into 100 common medications, learning about different types of medications, their uses, symptoms they treat, and correct pronunciation. This lesson will help you sound confident and professional when discussing these medications in English. To make your learning even more comprehensive, I've created a PDF guide for this lesson, which includes all the content we'll cover. Becoming a member gives you access to much more: the PDF guides, early video access, and additional resources on the way. It's a fantastic way to take your learning further and get even more value from each lesson. If you're interested in these extra tools and support, considering joining the student membership for the price of a cup of coffee. It's a great way to support the channel, deepen your English language skills, and stay connected with all the new content on the channel. Now let's get started with our lesson on 100 common medications. We will go through 20 different types of medication, starting with an explanation, followed by a list of example medications, and then some example English sentences. If you are looking for healthcare advice on medications or symptoms, then ask a healthcare professional like a doctor or a nurse. So if you're ready, let's get started. Our first medication type is anesthesia. Now on screen you can see here that we have two different spellings, one for American English and the other for British English. Anesthesia is used to induce a loss of sensation or consciousness, often for surgical procedures. These medications may be general, affecting the entire body, or local, targeting a specific area. Anesthetics are essential in pain-free medical interventions. Different types of anesthesia include propofol. This is used for general anesthesia and is commonly known as the Michael Jackson drug. Lidocaine. This is a local anesthetic often used in dental procedures. Isoflurane is a gas anesthetic commonly used during surgeries. Ketamine is a powerful anesthetic also used in emergency pain management. Bupivacaine is a long-acting local anesthetic used in epidurals. Let's take two of these words and use them in example sentences. The surgeon administered propofol to induce general anesthesia before the procedure. For minor dental work, the dentist used lidocaine to numb the area. Our next category of medicine is painkillers, also called analgesics. These medications are ones that relieve pain. They range from mild, over-the-counter options to stronger prescription drugs. Painkillers are classified into non-opioid, opioid, and NSAIDs. Different types of painkillers include aspirin, a common over-the-counter pain reliever, and anti-inflammatory. Ibuprofen. This treats mild to moderate pain. Morphine. This is a powerful opioid painkiller for severe pain. Acetaminophen, also known as Tylenol, is used for mild pain and fever. Codeine is an opioid used for pain relief and sometimes in cough syrups. After the surgery, the doctor prescribed morphine to manage the patient's pain. Ibuprofen is often recommended for reducing inflammation and mild pain. Our next medicine category is antibiotics. Antibiotics are medications that kill or inhibit the growth of bacteria, used to treat bacterial infections. They are not effective against viruses and should be only used as prescribed to prevent antibiotic resistance. Amoxicillin is a widely used antibiotic for bacterial infections. Azithromycin treats respiratory and skin infections. Ciprofloxacin is an antibiotic often prescribed for urinary tract infections. Doxycycline is used to treat various infections, including acne. Penicillin, one of the oldest antibiotics, is still used for specific bacterial infections. Let's take a look at our example sentences. The patient was prescribed amoxicillin for a bacterial throat infection. For skin infections, doxycycline is a common and effective choice. Let's move on to antidepressants. These are medications used to treat depression, anxiety, and certain other mood disorders. They work by balancing chemicals in the brain to improve mood, sleep, and energy levels. Our first antidepressant is fluoxetine. This is commonly known as Prozac. It treats depression and anxiety. Sertraline, known as Zoloft, is used for depression, anxiety, and PTSD. Amitriptyline is an older antidepressant, which is also used for chronic pain. Escitalopram, also known as Lexapro, is used for depression and generalized anxiety disorder. Venlafaxine treats major depressive and anxiety disorders. Fluoxetine is often prescribed for patients experiencing chronic depression. Sertraline is commonly used to manage both depression and anxiety. Our next medication classification is antipsychotics. This type of medication is used to manage psychosis, including schizophrenia and bipolar disorder. They help reduce hallucinations, delusions, and other severe mental health symptoms. Risperidone is used to treat schizophrenia and bipolar disorder. Olanzapine is prescribed for bipolar disorder and schizophrenia. Clozapine is used for treatment-resistant schizophrenia. Quetiapine treats both bipolar disorder and depression. And we have aripiprazole, which is also used for schizophrenia and bipolar disorder. The patient was given risperidone to help manage symptoms of schizophrenia. Olanzapine is effective for treating mood swings in bipolar disorder. Next up, we have antihistamines. Antihistamines relieve allergy symptoms by blocking histamine, a substance in the body that causes allergic reactions. They are used for conditions like hay fever, itching, and some respiratory allergies. Loratadine, also known as Claritin, is commonly used for seasonal allergies. Diphenhydramine, also known as Benadryl, relieves allergies and cold symptoms. Cetirizine treats hay fever and skin allergies. Fexofenadine is used for seasonal allergy symptoms. Hydroxyzine is used for itching and anxiety, often in short-term settings. Loratadine is effective for relieving symptoms of seasonal allergies. For severe itching, hydroxyzine may be prescribed as an antihistamine. Our next medication category is diuretics, also known as water pills. This type of medication helps the body eliminate excess fluid by increasing urine production. They're commonly prescribed for conditions like hypertension, heart failure, and kidney issues. Our first diuretic is furosemide. This drug is commonly used for heart failure. Hydrochlorothiazide treats high blood pressure and fluid retention. Spironolactone is a potassium-sparing diuretic used for fluid retention. Bumetanide is used to reduce swelling due to fluid buildup. Chlorthalidone is a diuretic often prescribed for hypertension. Let's check out our example sentences. The doctor prescribed furosemide to manage the patient's heart failure symptoms. Hydrochlorothiazide is commonly used to treat high blood pressure. Our next medication category is anticoagulants. These are often referred to as blood thinners. Anticoagulants prevent blood clots, reducing the risk of stroke, heart attack, and other cardiovascular issues. They are vital for patients at high risk of blood clots. Our first type is warfarin. Warfarin is a commonly used blood thinner. Next up, we have heparin, which is often used in hospitals for blood clot prevention. Dabigatran is an oral anticoagulant. Apixaban is used to reduce stroke risk. Rivaroxaban is a blood thinner for clot prevention. Warfarin is often prescribed to patients with an elevated risk of stroke. Apixaban is taken daily to prevent blood clots in high-risk individuals. Let's move on to anti-inflammatory drugs, otherwise known as NSAIDs. This type of medication is used to reduce inflammation, pain, and fever. They're commonly available over the counter and treat various conditions, from arthritis to headaches. Our first type of anti-inflammatory is ibuprofen. This is commonly known in the United States as Advil, a common NSAID. Naproxen is used for pain and inflammation. Celecoxib is often used for arthritis. Indomethacin is used to reduce inflammation in arthritis. Diclofenac is often prescribed for severe pain and inflammation. Ibuprofen is often used to reduce inflammation and treat mild pain. For joint pain, naproxen can be effective in reducing inflammation. Let's move on to antacids and acid reducers. This type of medication is used to relieve symptoms of acid reflux, heartburn, and indigestion. Antacids neutralize stomach acid, while acid reducers lower acid production in the stomach. Omeprazole is used for acid reflux and GERD. Ranitidine is commonly used for heartburn, but it is now discontinued in many markets across the world. Calcium carbonate, also known as the brand Tums, is an over-the-counter antacid. Famotidine is used to reduce stomach acid. Esomeprazole is used for acid reflux. Omeprazole is often prescribed for patients with chronic acid reflux. For quick relief, calcium carbonate can neutralize stomach acid on the spot. Let's move on to bronchodilators, or respiratory medications. This type of drug is one that helps open the airways in the lungs, making breathing easier. They are commonly prescribed for asthma, COPD, and other respiratory conditions. Albuterol is commonly used for asthma attacks. Ipratropium is used for COPD. Salmeterol is a long-acting bronchodilator. Theophylline is used for asthma and other lung diseases. Tiotropium is used for long-term COPD management. Let's check out our example sentences. During an asthma attack, albuterol provides quick relief by opening the airways. Salmeterol is often prescribed for patients needing long-term asthma control. Our next medicine category is antivirals. Antivirals are medications that treat viral infections by inhibiting the development of the virus. They are used for conditions like flu, herpes, and HIV. Our first antiviral is acyclovir. This is known as Civirix, and it's used for herpes infections. Oseltamivir, also known as Tamiflu, is used for influenza. Valacyclovir is used for herpes and shingles. Tenofovir is used for hepatitis B and HIV. Remdesivir is used for COVID-19 in specific settings. Acyclovir is prescribed to help manage herpes symptoms. For flu symptoms, oseltamivir is often recommended during flu season. Our 13th category of medication is anti-diabetics. Anti-diabetic medications help manage blood sugar levels in people with diabetes. These include insulin and various oral medications. Metformin is a commonly prescribed medication for type 2 diabetes. Insulin is a hormone used to control blood sugar, often injected. Glipizide stimulates insulin production. Sitagliptin helps control blood sugar. Next up, we have pioglitazone. This medication helps regulate glucose. Let's take a look at our example sentences. Patients with type 2 diabetes are often started on metformin to control blood sugar. Insulin injections are necessary for many patients with type 1 diabetes. Next up, we have corticosteroids, or commonly just referred to as steroids. These medications are used to treat a wide range of conditions, including asthma, allergies, and arthritis. They work by reducing inflammation and immune response. Prednisone is used for inflammation and autoimmune conditions. Hydrocortisone is available as a cream for rashes and inflammation. Dexamethasone is a powerful steroid used in severe inflammation cases. Methylprednisolone is used for severe allergies. And betamethasone is often used as a topical cream for skin conditions. Prednisone is commonly prescribed for patients with severe allergies. For joint inflammation, methylprednisolone can provide relief. Our next category of medication is laxatives and stool softeners. This type of medication helps relieve constipation by promoting bowel movements or softening stool, making it easier to pass. Psyllium, also known as Metamucil, is a fiber-based laxative. Next up, we have Docusate, which is a stool softener. Polyethylene glycol is used for constipation. There is also Senna, a herbal laxative available over the counter. Bisacodyl, also known as Ducalex, stimulates bowel movements. Let's check out our example sentences. First up, polyethylene glycol is recommended for chronic constipation. Docusate is a gentle option for softening stool without causing cramps. Our 16th category of medications is antihypertensives, also known as blood pressure medications. Antihypertensives are used to control high blood pressure, reducing the risk of heart attack, strokes, and kidney disease. Lisinopril is an ACE inhibitor used to lower blood pressure. Amlodipine is a calcium channel blocker. Losartan is an angiotensin II receptor blocker, or ARB. Metoprolol is a beta blocker also used for heart rate control. Hydrochlorothiazide is a diuretic also used to lower blood pressure. The doctor prescribed lisinopril to manage the patient's high blood pressure. Amlodipine helps relax blood vessels, making it easier for blood to flow. Our next type of medication is muscle relaxants. Muscle relaxants relieve muscle spasms and tightness, often prescribed for back pain, muscle injuries, and other painful conditions. First up, we have cyclobenzaprine. This is a common muscle relaxant. Methylcarbamol is used for muscle pain. Baclofen is used for muscle spasticity in neurological conditions. Up next, we have tizanidine, which treats muscle tightness. Diazepam, also known as Valium, is used as a muscle relaxant and anti-anxiety medication. Cyclobenzaprine is commonly used for relief from muscle spasms. For chronic muscle tightness, tizanidine may be prescribed. Our 18th category of medication is anti-seizure medications or anticonvulsants. This type of medication prevents or reduces the frequency of seizures. They are essential in the treatment of epilepsy and may be used for mood stabilization or neuropathic pain. Phenytoin is commonly used for epilepsy. Carbamazepine treats seizures and nerve pain. Valproate treats seizures and is also used for bipolar disorder. Up next, we have levetiracetam. This is a newer anti-seizure drug. Gabapentin is used for nerve pain and seizures. Let's check out our example sentences. Phenytoin is prescribed to control seizure activity in epilepsy. For neuropathic pain, gabapentin is commonly used as an off-label treatment. Our penultimate category is for antiemetics, also known as nausea relief. These types of medications are used to prevent or relieve nausea and vomiting, commonly prescribed for patients undergoing chemotherapy, surgery, or those with severe motion sickness. Ondansetron is a medication widely used to prevent nausea. Metoclopramide treats nausea and aids digestion. Prochlorperazine is used for severe nausea. Promethazine treats nausea and motion sickness. Scopolamine is a patch or tablet often used for motion sickness. Patients receiving chemotherapy are often prescribed ondansetron to manage nausea. Promethazine is a go-to medication for preventing motion sickness on long journeys. Our final category of medication is immunosuppressants. Immunosuppressants are medications that suppress the immune system, commonly used for patients with autoimmune diseases or those who have undergone organ transplants to prevent rejection. Cyclosporine is often used to prevent organ transplant rejection. Methotrexate is used for autoimmune conditions like rheumatoid arthritis. Azathioprine is used for lupus and Crohn's disease. Tacrolimus is often used for kidney and liver transplant patients. Mycophenolate is an immunosuppressant used after organ transplants. Cyclosporine is essential for patients who have undergone organ transplants. For managing autoimmune conditions, methotrexate can be an effective treatment. And there we have it. Thank you for joining me for this lesson on 100 common medications in English. I hope you found it useful in building your confidence with medical English. Remember, the key to mastering this vocabulary is practice and repetition, so feel free to revisit this lesson as often as you need. This lesson is broken down into 5 different categories, so you'll definitely learn lots of useful English. So let's get started, and our first category is prescription medication. Can I have my prescription filled here? Can I have my prescription filled here? How should I take this medication? How should I take this medication? What are the side effects of this drug? What are the side effects of this drug? Is this medication safe with my allergies? Is this medication safe with my allergies? Can I get a refill on this prescription? Can I get a refill on this prescription? What should I do if I miss a dose? What should I do if I miss a dose? In our next category, we will ask questions about over-the-counter medication. What is a good remedy for a headache? What is a good remedy for a headache? Do you have something for cold symptoms? Do you have something for cold symptoms? Can you recommend an allergy relief medicine? Can you recommend an allergy relief medicine? Is there an over-the-counter drug for coughs? Is there an over-the-counter drug for coughs? What should I take for stomach pain? What should I take for stomach pain? Do you have any natural supplements? Do you have any natural supplements? Our third set of phrases and questions relate to general health queries. What vitamins should I take for better health? What vitamins should I take for better health? Do you have sunscreen for sensitive skin? Do you have sunscreen for sensitive skin? What are the best products for skincare? What are the best products for skincare? Can you suggest a good pain reliever? Can you suggest a good pain reliever? Which product is best for wound healing? Which product is best for wound healing? How do I check my blood pressure? How do I check my blood pressure? Let's move on to our fourth category, which is queries about pharmacy services. Do you offer flu shots here? Do you offer flu shots here? Can I schedule a health checkup? Can I schedule a health checkup? Is there a pharmacist available for consultation? Is there a pharmacist available for consultation? Can I get travel vaccinations here? Can I get travel vaccinations here? Do you provide medicine home delivery? Do you provide medicine home delivery? Are there any health screenings available? Are there any health screenings available? Our last category deals with phrases relating to specific conditions. What's best for managing diabetes? What's best for managing diabetes? Can you recommend something for arthritis pain? Can you recommend something for arthritis pain? What do you have for heartburn relief? What do you have for heartburn relief? Is there an effective treatment for insomnia? Is there an effective treatment for insomnia? What options are there for high blood pressure? What options are there for high blood pressure? Do you have products for asthma relief? Do you have products for asthma relief? Today we're delving into the dynamic field of emergency medicine. Whether you're a healthcare professional, a student, or simply interested in expanding your English vocabulary, you're in for an informative ride. So if you're ready, let's begin our English lesson, and we're going to start with the topic of today's lesson, emergency medicine. This is a medical speciality focused on the prompt assessment, diagnosis, and treatment of acute illnesses and injuries. Emergency physicians work in emergency departments to provide immediate care and stabilize patients in critical conditions. Our next term is triage. Repeat after me. Triage. Triage is the process of quickly assessing and prioritizing patients based on the severity of their condition. It ensures that those with the most urgent needs receive immediate attention. Triage. Trauma refers to physical injuries resulting from accidents, falls, or violence. Emergency medicine often deals with trauma cases that require rapid intervention. Repeat after me. Trauma. Resuscitation involves efforts to revive or restore normal bodily functions in a patient experiencing cardiac arrest, respiratory failure, or other life-threatening emergencies. Resuscitation. Related to the term resuscitation, we have defibrillation. This is the delivery of an electric shock to the heart to restore its normal rhythm. Automated external defibrillators, or AEDs, are commonly used in emergency situations. Defibrillation. We also have cardiopulmonary resuscitation, often called CPR. This is a life-saving technique that combines chest compressions and rescue breaths to maintain blood circulation and oxygenation in a person whose heart has stopped. Intubation involves inserting a tube into the airway to assist or secure the passage of air into the lungs. It is often performed in cases of respiratory distress. Repeat after me. Intubation. Our next term is epinephrine. Repeat after me. Epinephrine. This can also be known as adrenaline. It is a hormone and medication used in emergency situations to treat severe allergic reactions, also known as anaphylaxis, and cardiac arrest. Let's try it one more time. Epinephrine. Intravenous therapy, or IV therapy for short, involves giving fluids, medications, or blood products directly into a patient's veins, ensuring rapid absorption in emergency situations. So we have intravenous therapy, or the abbreviation is IV therapy. In the context of emergency medicine, shock is a life-threatening condition where insufficient blood flow to vital organs leads to cellular and organ dysfunction. Prompt intervention is crucial to prevent further complications. Shock. Our next term is hemorrhage. A hemorrhage is excessive bleeding, and controlling it is a critical aspect of emergency medical care. Techniques like direct pressure and tourniquets may be used. Repeat after me. Hemorrhage. A fracture is a break or crack in a bone. Emergency medicine addresses fractures with assessments, immobilization, and referral to specialized care. Fracture. Our next term is naloxone. This is a medication used to rapidly reverse opioid overdose by binding to opioid receptors, restoring normal respiration. Naloxone. Let's move on to seizure. A seizure is a sudden, uncontrolled electrical disturbance in the brain. A seizure can sometimes be referred to as a fit. This condition is supported with emergency medicine with medications and supportive care. Seizure. Decontamination involves the removal or neutralization of harmful substances from a person. This is often necessary in cases of chemical exposure or contamination. Decontamination. From medication to comfort, our next section is palliative care. These 100 phrases are about dignity, empathy, and supporting patients through difficult moments. Today's lesson is dedicated to a sensitive but crucial topic in nursing, palliative care. Palliative care is all about providing relief from the symptoms and emotional stress of serious illness. It requires not only technical skill, but also compassionate communication with patients and their families. In this lesson, I'll take you through 100 essential English phrases that nurses can use when working in palliative care settings. These phrases will cover everything from explaining the purpose of palliative care to comforting patients in their final days. Also, with this lesson, there's a PDF guide available for download, which includes all the phrases from this lesson. Let's begin this lesson on 100 English phrases for palliative care. Our first section is introducing patients to palliative care. This first set of phrases will give you communication skills to introduce palliative care to patients and their families. These phrases will help explain the purpose of this care and what they can expect. Palliative care is focused on improving your quality of life by managing symptoms and providing emotional support. This phrase keeps the focus on comfort and support to ease any concerns about the term palliative. We are here to ensure that you feel as comfortable as possible. This phrase reassures the patient that the goal is comfort, which is often a top concern. Palliative care can help manage your pain and other symptoms to help you live as well as possible. Here we are emphasizing the positive impact palliative care can have on the quality of life. Our team will work closely with you and your family to create a care plan tailored to your needs. Including the family in care discussions can help everyone feel involved and reassured. Palliative care is not just for end-of-life situations. It's about managing symptoms and providing relief at any stage of illness. Here we can clarify that palliative care is not synonymous with end-of-life care, which is a common misconception. We will focus on what matters most to you and your family. Personalizing care helps the patient feel understood and supported. This type of care focuses on your physical, emotional, and spiritual well-being. With this phrase, we are highlighting the holistic approach that palliative care offers. We are here to help you and your family cope with the emotional challenges of your illness. Here we can emphasize emotional support, as patients and families often need reassurance. Our goal is to reduce pain and improve your overall comfort, so you can focus on spending time with loved ones. Focusing on comfort and quality time can ease patient anxiety. Palliative care is about living as fully as possible, even with a serious illness. This phrase reframes palliative care as something positive and life-affirming. Next, we'll go over phrases you can use to help patients understand and cope with the changes that may come with palliative care. You may notice some changes in your energy levels, but we will help you manage those. Here we are acknowledging changes while offering reassurance. It's normal to feel more tired or weak, and we'll adjust your care plan to help. Here we are explaining that adjustments will be made to ease discomfort. Your appetite may decrease, and we will monitor your nutrition to make sure you're getting what you need. This phrase helps address concerns about eating, and it can reduce stress for both patients and families. We can provide support with daily activities if you're feeling too weak to manage on your own. Offering help with daily tasks can make patients feel less overwhelmed. You might experience some new symptoms, but we'll be here to help manage those as they arise. You can reassure patients with this phrase. It will help them see that they won't face new symptoms alone. We can make adjustments to your medications to keep you as comfortable as possible. Here we can assure patients that their care is flexible and can adapt to their changing needs. It's important to listen to your body and rest when you need to. Here we are encouraging patients to rest, which can help them cope with fatigue. If certain activities become too difficult, we can offer alternatives to make things easier. Here we are providing solutions that help maintain the patient's independence. You might find that certain treatments are no longer necessary. We can discuss the best plan for your care. Here we can help patients understand that treatment goals may change as their illness progresses. We'll focus on the most important treatments to maintain your comfort and quality of life. This phrase can help reassure patients that the care plan will prioritize their comfort. Now let's look at phrases for explaining palliative care to family members. It's important to communicate clearly and compassionately with the patient's loved ones. We'll work closely with you to make sure your loved one is comfortable. This phrase can help reassure families that they are part of the process. Palliative care can help manage pain and other symptoms to improve their quality of life. This phrase emphasizes the benefits of symptom management. We'll be monitoring their condition closely and adjusting care as needed. Here we are explaining that care is ongoing and adaptable. You can reach out to us at any time if you have questions or concerns about their care. Offer open lines of communication, which can help reduce family anxiety. Our goal is to keep them comfortable and ensure they have the best possible quality of life. This phrase reassures families that the focus is on the patient's comfort. We'll discuss any changes in their condition with you immediately. With this phrase, you are keeping families informed to build trust. If there's anything you need during this time, please don't hesitate to ask. It's important to make families feel supported and included. We can provide emotional support to help you cope with the challenges of caring for a loved one. Here we are addressing the emotional toll caregiving can take on families. It's important to take care of yourself as well. We're here to help you through this process. With this phrase, you're encouraging family members to prioritize their well-being too. We will work with you to ensure your loved one's care plan is in line with their wishes. Here we are highlighting the importance of respecting the patient's wishes and family input. Palliative care often involves discussing different treatment options with patients and families. Let's go over phrases you can use to help navigate these conversations. We will focus on treatments that improve your comfort and manage your symptoms. Here we are reassuring the patient that treatments are aimed at making them feel better. Certain treatments may no longer be necessary, but will keep you informed about your options. This phrase helps ease concerns about discontinuing treatments by emphasizing patient choice. We'll discuss any changes to your treatment plan with you and your family. Keep communication open to reduce patient anxiety. Our priority is your comfort, so we'll adjust your medications as needed. This phrase ensures that patients know that their treatment is flexible. We'll focus on pain management and relieving any symptoms you may be experiencing. Here we are emphasizing the importance of addressing pain and symptoms. We'll discuss the benefits and side effects of each treatment option. Provide clear information to help patients make informed decisions. If you experience any discomfort, please let us know so we can make adjustments. Encourage patients to communicate openly about any discomfort, ensuring they feel empowered to request changes. You may choose to stop certain treatments if they no longer improve your quality of life. Reassure patients that it's okay to make decisions based on their comfort. It's important to focus on what makes you feel better day to day and will help guide you through those decisions. Help patients feel supported in making choices about their care. Your care plan will be regularly reviewed and updated based on how you're feeling. Ensure patients that their care is adaptable and regularly assessed. In palliative care, you may encounter difficult situations with patients or family members who are upset, confused, or resistant to care. Here are some phrases to help navigate those challenging conversations. I understand that this is a difficult time, and we're here to support you. Acknowledge the difficulty of the situation and offer emotional support. It's okay to feel frustrated or upset. We're here to listen and help you however we can. Validate the patient's or family's emotions to build trust. We want to work together with you to make sure your loved one is as comfortable as possible. You can use this phrase with family members to emphasize the collaborative nature of the care process. I hear your concerns, and I'll make sure to communicate them with the rest of the care team. Show that the patient's or family's concerns are being taken seriously and will be addressed. Let's take a moment to discuss any questions or worries you have about the care plan. Here we are creating a space for open discussion and addressing confusion. We understand that this is overwhelming, and we're here to walk you through every step. Provide reassurance that they won't be left to navigate the situation alone. It's important that we work together to find the best way to care for your loved one. Encourage collaboration between the care team and the family. We are committed to providing the best care possible, and your input is valuable. Here we are reassuring families that their thoughts are an important part of the process. I understand that this is a stressful time, but we are here to help in any way we can. With this phrase, we are acknowledging the stress and providing emotional support. Let's discuss any changes you'd like to see, and we can explore our options. Offering options helps to de-escalate situations by giving the family some control. Next, we'll cover phrases for the end of life stage, when it's crucial to provide clarity and comfort for both patients and their families. We will do everything we can to ensure that you are comfortable and pain-free. Focus on comfort as the top priority. At this stage, the goal is to manage symptoms and provide emotional and physical comfort. Clarify the shift from curative treatment to comfort care. We will be closely monitoring you to make sure any pain or discomfort is addressed immediately. Reassure patients that they will be cared for attentively. It's okay to talk about any fears or worries you might have. We're here to listen and support you. Encourage open dialogue about end-of-life concerns. We'll focus on the things that matter most to you in these moments. Help patients feel empowered in making decisions about their care. You are not alone. Your care team and family are here to support you. With this phrase, we are reassuring patients that they are surrounded by support. We will help you and your family through every step of this process. With this phrase, we are emphasizing the presence of support for both the patient and their family. Our goal is to make this time as peaceful as possible for you and your loved ones. Reassure patients that their peace and comfort are a priority. We're here to answer any questions you may have about what to expect in the coming days. Offer information to ease anxiety about the unknown. If you feel any discomfort or fear, please let us know immediately so we can help. Encourage patients to speak up about their needs. As patients near the end of life, communication shifts toward offering comfort and ensuring peace. Here are some phrases to help guide those conversations. We're here with you, and we'll do everything to keep you comfortable. Reassure patients that they are not alone in their final days. You are surrounded by people who care deeply about you. Focus on the emotional support available to the patient. It's okay to rest now. We'll take care of everything. Give permission for the patient to let go and rest. We'll be here to support your family through this difficult time. Reassure the patient that their loved ones will be cared for. You've been so strong, and now it's time to rest. Here we are offering comforting words that acknowledge the patient's strength. You are safe here, and we will do everything to ensure you feel peaceful. Reinforce the idea of safety and peace. We're here for you, and we'll stay by your side through everything. Assure the patient of constant support. It's okay to let go if you feel ready. We're here with you. With this phrase, you are offering compassionate permission for the patient to pass when they feel ready. We're here to keep you comfortable and at peace, surrounded by love. Emphasize comfort and the presence of loved ones. We will honor your wishes and keep you at peace. Here we are reinforcing that the patient's wishes will be respected. After a patient passes away, communicating with family members requires great sensitivity. Here are phrases to help with sharing the news of death compassionately. I'm so sorry to inform you that your loved one has passed away peacefully. This is a standard and expected way to inform someone of a loved one's death. It has a gentle tone to soften the blow. Your loved one passed away surrounded by care and love. Here we are offering comfort in knowing that the patient was not alone. We did everything we could, and they were peaceful in their final moments. Reassure families that their loved one did not suffer. Please take all the time you need to process this, and we'll be here to support you. Give families space to process while offering ongoing support. We're here to answer any questions you have during this difficult time. Leave the door open for questions to help families cope. It's important to take your time, and we're here whenever you're ready to talk. Reassure families that there is no rush to process the news. We can offer support and resources to help you and your family through this. Here we can point families toward grief resources for further support. Your loved one was cared for with dignity, and we were with them until the very end. Emphasize that compassionate care was provided to the patient. We understand this is a difficult time, and we're here to help you in any way we can. Offer practical and emotional support for families. Please let us know if there's anything we can do to help you right now. Ensure families feel supported in the immediate aftermath of the patient's death. After a patient passes away, families often need emotional support to process their grief. let's go over some phrases to offer comfort and practical support during this difficult time. I am so sorry for your loss. We are here to support you however we can. Here we are leading with compassion and acknowledging their grief. Please know that you're not alone. We are here to offer any support you need. Reassuring the families that they have access to help them during this difficult period. It's okay to feel overwhelmed. We can help you with any next steps. Normalize feelings related to grief and offer practical assistance. We have resources available if you'd like to speak with someone about your grief. If possible, you can offer professional support resources such as grief counsellors. Take as much time as you need. We'll be here to help when you're ready. With this phrase, you are giving families permission to grieve at their own pace without feeling rushed. We can help you with the immediate arrangements if you feel ready to discuss them. Offer practical help with post-death arrangements when the family is ready. Your loved one was cared for with respect and dignity at all times. Here you can provide further comfort by reassuring the family that the patient received compassionate care. This is a difficult time, and we are here to provide emotional and practical support. This phrase acknowledges the difficulty of the situation and offers multi-level support. If you'd like, we can arrange a meeting with a chaplain or counsellor for additional support. If possible, you can offer spiritual or emotional support tailored to the family's needs. We'll give you as much time as you need with your loved one before proceeding. Here you can ensure the family feels in control and can take time to say goodbye. Finally, let's look at phrases you can use for follow-up conversations with families and offering grief support in the weeks after a loss. I wanted to check in and see how you're doing. We are here to offer support if you need it. This is a nice way to reach out to families to show continued care and concern. Please don't hesitate to reach out if you need someone to talk to or help with anything. Keep the lines of communication open for families who may need support later. We can provide you with resources for grief counselling and support groups if you're interested. Offering professional help can be a crucial resource for families. If you have any further questions or concerns about your loved one's care, we are happy to answer them. Provide an open door for lingering questions, especially about the patient's final moments. Grief is a personal journey, and there is no right or wrong way to go through it. With this phrase, we are normalizing different grief experiences and give family members permission to grieve in their own way. We understand that this is a difficult time, and we're here to support you as long as you need. If possible, you can offer long-term support, letting families know they aren't forgotten after the initial loss. Would you like us to send over any additional resources on coping with loss? Provide access to grief materials and other support tools when needed. Please know that you are not alone in your grief. We're here to help whenever you're ready. Reinforce that the family has ongoing support available to them. It's okay to reach out whenever you feel ready. We'll be here when you are. Provide comfort by allowing the family to dictate when they're ready for more interaction. Let us know if there's anything we can do to help you and your family during this time. This is a nice way to end a conversation with a broad offer of support to meet their individual needs. And that's the end of our lesson on 100 essential English phrases for nurses in palliative care. That was one of the most emotional and important parts of this lesson. Now, let's reset and focus on movement. 50 phrases for physiotherapy and rehab communication. Do me a favor, help me support nurses around the world. Share this video with a colleague if you think it's been helpful. Are you learning English and struggling to find the right words when speaking with patients? Maybe you know exactly what you're doing clinically, but explaining exercises, giving encouragement, or answering patient questions in English feels like a challenge. If so, this lesson is for you. Hi, I'm Jer and welcome to Learning English Pro, the channel where healthcare professionals improve their English communication skills and build confidence in their careers. In today's lesson, we'll cover 50 essential phrases. These phrases will help you explain exercises, guide treatments, and connect with your patients in a clear and professional way. Good communication isn't just helpful, it's essential for patient care. Research shows that clear communication improves treatment success, builds trust, and helps patients recover faster. However, you might find it difficult to explain complex instructions or encourage patients with the right vocabulary. Many patients might not speak your first language, and that can make every interaction feel even harder. These are simple, practical phrases that you can use every day to feel more confident and effective. To help you even more with this lesson, I've created a downloadable guide. It includes all phrases from this video, interactive exercises to practice, use it with the video to build your confidence through repetition and regular practice. If you want to join the student membership on my channel, just click the link in description. There are lots of perks to help you boost your English learning. This lesson was actually inspired by one of my student members, Tatiana, who recently requested a video specifically for physical therapists and rehabilitation specialists. Thank you, Tatiana, for your suggestion. It's always great to create lessons tailored to your needs, and as a student member, your requests get priority. In our first category, we will look at phrases related to initial assessment. Can you tell me where you're feeling pain? This phrase highlights the importance of understanding the patient's specific pain points, helping to focus the assessment and treatment plan. When did the pain start, and has it changed over time? With this question, we're emphasizing the timeline of the issue, which can provide clues about the injury or condition. Have you had any previous injuries or surgeries in this area? This phrase ensures we're gathering the patient's medical history to avoid complications and provide tailored care. Can you describe how the pain feels? Sharp, dull, throbbing, or something else? Here we're encouraging the patient to give detailed descriptions, which can aid in diagnosing the issue more accurately. Does the pain get worse with certain movements or activities? This is a great phrase for identifying triggers and understanding the patient's functional limitations. Let me know if anything I do causes discomfort. With this sentence, we ensure the patient feels comfortable communicating during the assessment. Let's move on to our second category, which is patient education. This exercise targets the muscles that support your spine. Here we educate the patient about the purpose of a specific exercise. Good posture can help reduce your pain over time. This phrase highlights the benefits of maintaining proper posture. Strengthening this area will improve your overall stability. With this sentence, we're explaining the functional benefits of targeted strengthening. Using ice packs can help reduce inflammation after exercises. This phrase provides actionable advice for managing discomfort at home. Regular stretching can prevent stiffness and improve flexibility. This is a great way to emphasize the importance of incorporating stretching into daily routines. Moving right along to our third category, which is treatment instructions. Let's start with some gentle stretches to warm up your muscles. This phrase introduces the session and sets the tone for a gradual and safe start to treatment. I'll guide you through this movement. Try to copy me as closely as you can. Here we're emphasizing clarity and patient engagement by providing a visual and verbal guide. Remember to breathe evenly while doing this exercise. This is a great reminder for patients to stay relaxed and avoid holding their breath during exercises. Let's focus on improving your range of motion in this area. With this phrase, we explain the goal of the exercise, keeping the patient informed and motivated. If you feel any sharp pain, stop immediately and let me know. This phrase highlights the importance of safety and open communication during treatment. Keep your movements slow and controlled to avoid straining the muscles. This sentence emphasizes proper form and minimizes the risk of injury. You might feel some discomfort, but it shouldn't be painful. This phrase sets realistic expectations for the patient during the session. Let's adjust this exercise to make it more comfortable for you. This is a great phrase for personalizing the treatment and showing empathy. Hold this position for 5 seconds, then slowly release. Here we are providing clear and actionable instructions for a specific exercise. We're already on our fourth category and it's a nice one: how to give encouragement and feedback to patients. You're doing great. Keep it up. With this phrase, we're reinforcing the patient's efforts and boosting their confidence. Let's try that movement again, but with a little less force. This is a constructive way to provide feedback and refine the patient's technique. You're making excellent progress. I can see an improvement already. This phrase helps keep the patient motivated and reassures them of their progress. It's okay to take a break if you need to. This phrase emphasizes the importance of pacing and listening to the body. Great job! You've really improved your balance since last time. With this sentence, we're recognizing and celebrating the patient's achievements. There are always challenges with treatment, and in our fifth category, we have some great phrases to deal when issues pop up with patients' treatment. Let's modify this exercise to suit your current range of motion. With this phrase, we show flexibility and adaptability in treatment. If this position is uncomfortable, let's try an alternative approach. This phrase ensures the patient feels supported and understood. It's normal to feel frustrated, but every small step counts. This is a great way to acknowledge the patient's emotions and keep them motivated. We can adjust the intensity based on how you're feeling today. With this sentence, we're prioritizing the patient's well-being and comfort. Recovery takes time, but you're on the right track. This phrase reassures the patient and fosters patience during the process. With our sixth category, we're going back to some more encouraging English with some great motivational phrases. Each session brings you closer to your goals. With this phrase, we're keeping the patient focused on their progress. The effort you're putting in now will pay off in the long run. This is a great way to encourage persistence and long-term thinking. Remember, small improvements add up over time. This phrase motivates the patient to appreciate gradual progress. You're stronger than you think. Let's keep going. With this sentence, we provide a boost of confidence to the patient. You've got this. I'm here to help you every step of the way. This phrase reinforces the therapist-patient partnership and trust. We're almost at the end of our lesson. Our second last category is very important: safety and precautions. Let's make sure your movements are safe and within your limits. This phrase emphasizes the importance of safety during exercises. If you're feeling dizzy or lightheaded, stop immediately and let me know. With this sentence, we ensure the patient knows how to respond to unusual symptoms. Be mindful of your posture when lifting objects at home. This is a great way to provide practical advice for daily activities at home. We'll avoid any movements that could strain your injury further. Here we're showing care and caution in tailoring the treatment plan. Use a support or brace if you feel unstable during activities. This phrase offers a helpful suggestion for maintaining safety and confidence. Can you believe we're on our last category already? These handy phrases will be useful when you're closing the session with the patient. Let's finish with some light stretches to cool down. This phrase helps transition from active exercises to a more relaxed state. How do you feel after today's session? With this question, we're encouraging patient feedback to gauge the session's success. Make sure to drink plenty of water after this session. This phrase emphasizes self-care and helps prevent soreness or fatigue. You've worked hard today. Well done. This phrase acknowledges the patient's effort and ends the session on a positive note. I'll see you at your next appointment. Keep practicing the exercises we went over. This is a great way to reinforce the importance of consistency in the patient's progress. You're making great progress. We'll build on this next time. With this sentence, we set a positive tone for future sessions. Don't hesitate to reach out if you have any questions before your next appointment. This phrase encourages ongoing communication and trust. You should be proud of the effort you put in today. This phrase ends the session on an uplifting note, fostering confidence. Consistency is key. Keep up the good work. With this sentence, we encourage the patient to stay committed to their recovery. Take care, and I'll see you next time. This is a friendly and professional way to close the session. I hope these 50 essential phrases will help you feel more confident in your patient communication and make a real difference in your daily interactions. Let's shift again. This next section is tough, but so important. These 30 phrases are designed for delivering difficult news with professionalism and care. If this content matters to you, please support the channel by joining the student membership. Today we're tackling one of the most difficult aspects of healthcare, delivering bad news to patients. As healthcare professionals, breaking bad news requires not only medical knowledge, but also sensitivity and empathy, especially when communicating in English. In this lesson, I'll teach you key phrases and strategies to help you deliver tough news with compassion and professionalism. We'll cover how to set the tone, deliver the news clearly, and respond to emotional reactions from patients and their families. To help you follow along, I've created a PDF guide that includes all the phrases from this lesson, as well as extra tips for handling those conversations with care. The guide is designed to be your go-to resource, making it easy to review and practice these essential phrases whenever needed, along with the video. You can download the guide using the link in the video description. Let's get started. Before delivering difficult news, it's crucial to set the tone and prepare the patient for what's coming. Here are some phrases you can use to begin the conversation with care and professionalism. I'm afraid I have some difficult news to share with you. This phrase is a direct but sensitive way to introduce the conversation. Before we begin, I want to make sure you feel comfortable asking any questions you may have. With this phrase, you're encouraging open communication and making the patient feel heard. This is not an easy conversation, but I want to be as clear and supportive as possible. Here we are acknowledging the difficulty of the situation while showing empathy. Once you've prepared the patient, it's important to deliver the news clearly and directly, without being abrupt. Let's look at how to phrase this carefully with some examples. Unfortunately, the test results show that the condition is more serious than we initially thought. This phrase is a compassionate way to introduce the severity of the condition. I'm very sorry to inform you that the cancer has returned. Here we are delivering the news with a clear and compassionate tone. We've explored all possible options, but the prognosis is not as positive as we had hoped. And here we're balancing honesty with empathy when discussing a poor prognosis. I know this is hard to hear, but we need to discuss the next steps moving forward. With this phrase, we are transitioning from delivering the news to discussing future actions. When patients receive bad news, they often react emotionally. It's important to remain calm, offer support, and give them space to express their feelings. Here are some phrases you can use in these moments. I can see this is very overwhelming for you. Please take your time to process what I've said. With this phrase, we are acknowledging the patient's emotional response and giving them space. It's completely normal to feel this way. I'm here to answer any questions you might have. Here we are validating the patient's emotions and offering continued support. I understand that this is difficult news, and I want to make sure you feel supported every step of the way. Here we are offering reassurance and emphasizing your role in their care. If you'd like, we can take a moment before we discuss the next steps. With this phrase, we are suggesting a pause to give the patient time to compose themselves. Once the initial shock of the news has passed, patients will often want to know what happens next. Here are some phrases to help you guide that conversation. We can discuss the treatment options available to you when you're ready. With this statement, you're allowing the patient to choose when they want to move forward with the conversation. There are several ways we can manage your symptoms and make sure you remain comfortable. Here we are offering reassurance about symptom management and patient comfort. I'll be working with a team of specialists to ensure you receive the best possible care moving forward. Here we are offering more reassurance and letting the patient know that they will receive ongoing support from a team. We'll schedule a follow-up appointment to review the treatment plan, and you can always contact me with any questions in the meantime. With this phrase, we are providing a clear path forward and encouraging open communication. It's not just about delivering the news and discussing treatment. It's also important to provide emotional support and encouragement. Here are some ways you can offer that support. I'm here to support you, and we will work through this together. With this statement, you are offering reassurance by emphasizing partnership in care. Please know that you're not alone in this. We have resources and support available to help you through this difficult time. Here we are offering more emotional and practical support to the patient. I know this is overwhelming, but we'll take it one step at a time. And here we're helping the patient focus on manageable next steps. If you ever feel unsure or need someone to talk to, please don't hesitate to reach out. With this phrase, you're encouraging the patient to lean on you for guidance and support. That's it for today's lesson on delivering bad news to patients. I hope these phrases and strategies help you approach these difficult conversations with more confidence and empathy. That last section took focus. Now let's explore mental health. 20 phrases to support patients with compassion and respect. The guide for this lesson has everything organized. It's great for educators and students. Find it in the store or in your membership hub when you join. In today's lesson, we'll be diving into advanced medical English for mental health communication. This lesson is especially useful for nurses and other healthcare professionals who want to improve their communication skills in sensitive mental health situations. In this lesson, we'll cover essential communication skills for when discussing mental health with patients. You'll learn key phrases for initial assessments and strategies for handling sensitive topics such as anxiety, stress, and feelings of isolation. By mastering these approaches, you'll enhance your ability to build trust and provide compassionate care in challenging situations. So if you're ready, let's get started. In mental health care, using the right language is crucial to support, comfort, and guide patients through difficult conversations. Let's start by learning essential phrases that can help establish trust and understanding. Can you tell me more about how you've been feeling lately? When did you first start feeling this way? Would you like to talk about what has been on your mind recently? Have you experienced these feelings before, or is this new for you? What do you think might be contributing to how you're feeling right now? These phrases are all great for initial assessment of mental health care patients. Let's take a look at some phrases for showing empathy and support. I'm here to listen and support you. Your feelings are valid. It's okay to feel this way, and we'll work through this together. You're not alone in this. There are people who care and want to help. I appreciate your courage in sharing how you feel with me. It sounds like you've been going through a lot. I'm glad you're speaking up about it. Remember, using these phrases can help you open the conversation gently and make patients feel heard. Remember, in mental health care, it's not just what you say, but how you say it. Use a calm and reassuring tone. Now let's look at how to address more challenging aspects of mental health care. Sometimes patients may express thoughts or feelings that are difficult to respond to. Here are some key strategies. I can see that you're feeling anxious. Let's take a deep breath together and we can talk more about what's worrying you. It's understandable that you're feeling stressed. Would you like to share what's been making you feel this way? Anxiety can be overwhelming. Are there particular times of day or certain situations that make it worse? The next few phrases can be used when a patient mentions feeling overwhelmed. It sounds like everything is becoming too much to handle right now. Let's break things down and talk about what's troubling you the most. You don't have to carry all of this alone. We're here to support you in finding ways to manage these feelings. Let's focus on one step at a time and see what feels most manageable for you. If a patient mentions isolation or loneliness, the following phrases can be useful. I understand that feeling alone can be very difficult. Have you considered reaching out to a close friend or family member, or would you like us to explore some support groups together? Would it help if we talked about ways to stay connected with others, even in small ways? It's natural to feel isolated at times, but there are resources and people who can help bridge that gap. Next, we have some phrases for addressing statements about depression or hopelessness. Thank you for sharing this with me. It's important to talk about these feelings so we can find the right support. I hear that things feel overwhelming right now. Let's discuss some strategies or people you can talk to who can support you through this. Your well-being is important. Would you like to talk more about this so we can explore some options together? These responses show empathy while encouraging patients to open up further or think of actionable steps to improve their situation. Encouraging patients to reflect on their emotions and take positive action is another important part of mental health support. Here are some phrases and techniques. What are some things that usually help you feel better, even just a little? Have you noticed if there are certain situations or activities that improve your mood? Can you think of times when you felt more in control? What was different then? Reflecting on small victories can be really powerful. Is there anything that went well recently? Our next batch of phrases are useful when you're suggesting steps forward. Would you be open to trying some relaxation techniques or activities that you enjoy? Let's think of one small thing you could do today that might help you feel better. There are some self-care strategies that might be useful. Would you like me to share a few ideas? Would connecting with a mental health professional be something you consider? We can help find someone who fits your needs. And lastly, let's take a look at some phrases that can help to empower the patient. Remember, it's okay to take things at your own pace. Progress is still progress, no matter how small. You have shown so much strength by talking about this. Let's find ways to build on that strength. Taking the first step can feel hard, but I'm here to help you figure out the next steps. Thank you for joining me in today's lesson on Advanced Medical English for Mental Health Communication. Remember, showing empathy, listening actively, and using a supportive language can make a huge difference in how your patients feel during difficult times. Now we go deeper. This section is for nurses working in dedicated mental health settings. 50 professional phrases for daily support, observation, and therapeutic interaction. If you're working in this field, hit the like button. We need more mental health English content out there. Did you know that effective communication can improve patient outcomes by up to 30% in mental health care? For healthcare professionals, the right words are not just helpful, they can be transformative. Clear, empathetic language bridges the gap between a patient's struggle and the support they need. Hi, I'm Jer and welcome to Learning English Pro, the channel for healthcare professionals like you to excel in English and advance your career. Whether you're a therapist, counsellor, or mental health care worker, today's lesson is tailored to help you master essential English phrases for meaningful conversations in your practice. In this lesson, we'll explore essential language healthcare professionals need to provide compassionate and effective mental health care. If you're a student member, you'll find a downloadable PDF guide on the membership tab for this lesson. It includes all the content from the video, plus additional exercises to perfect your English skills. If you want to join my student membership, the link to join is in the video description below. So let's get started on our first section. Phrases for inquiring about emotions and mental states. This is where every conversation begins. How have you been feeling lately? This phrase is a neutral and inviting way to encourage someone to open up about their emotions. Can you tell me more about what's been on your mind? This is a great way to show genuine interest in understanding a patient's thoughts and feelings. What's been troubling you recently? This question gently directs the conversation toward any specific issues the patient may be facing. Do you feel more anxious or stressed than usual? This phrase is helpful for identifying heightened emotions like anxiety or stress. Are there certain moments when you feel worse or better? It's useful for encouraging patients to reflect on patterns or triggers in their emotional experiences. Can you describe how this situation makes you feel? This phrase prompts the patient to provide a detailed description of their emotional response. Do you feel supported by those around you? This is a great way to open a discussion about the patient's social and emotional support network. Have you noticed any changes in your mood recently? This is a gentle way to help the patient identify shifts in their emotional well-being. Do you feel like you've been able to manage your emotions? This is a helpful question for assessing how well they are coping with their feelings. Is there a particular event that's affecting how you feel? This is a good phrase for exploring potential triggers or recent life events. Let's move on to our second section, phrases to explore and understand emotions. These phrases guide deeper discussions and validate feelings. It sounds like you're feeling overwhelmed. Is that right? This phrase is great for showing empathy and confirming the patient's emotions. What do you think is causing these feelings? This is a useful way to encourage the patient to reflect on the root causes of their emotions. How long have you been feeling this way? This question helps you understand the duration and intensity of their emotional state. What do you usually do when you feel like this? Here we have a thoughtful way to explore their coping mechanisms or habitual responses. Can you give me an example of when this feeling is strongest? This phrase invites the patient to share specific situations that intensify their emotions. How do these emotions affect your daily life? This is a helpful way to understand the broader impact of their feelings. When you feel this way, what thoughts usually come to mind? This is a great way to connect their emotions with their thought patterns. Have you noticed any physical symptoms connected to these feelings? This question helps link emotional well-being to physical health. Do you find it easier to talk about these feelings with certain people? This is a phrase that encourages reflection on their communication habits and support system. What do you think might help you feel better? This is a constructive way to prompt them to consider solutions or coping strategies. Let's move on to the next section, phrases to calm and soothe the patient. These phrases are useful to provide comfort and reassurance to patients during difficult moments. It's okay to feel this way. Many people do in similar situations. Here we have a calming phrase to normalize their emotions and reduce feelings of isolation. Take your time, we're not in any rush. This reassures the patient that they can process their emotions at their own pace. You're safe here, and I'm here to listen. This is a comforting statement to establish a secure and supportive environment. Let's take a deep breath together and focus on the present. This phrase is helpful for grounding the patient during heightened anxiety. It's okay to not have all the answers right now. Here we have a soothing reminder that uncertainty is part of the healing process. You've been through a lot, and it's understandable to feel this way. This is a compassionate way to validate a patient's struggles and emotions. Let's focus on one thing at a time. This phrase is effective for calming feelings of being overwhelmed. I can see that this is really difficult for you. This phrase acknowledges their struggle and offers empathetic support. You're doing the best you can, and that's enough. This is a reassuring phrase to combat self-doubt. We'll work through this together. This phrase provides a sense of partnership and support in the patient's journey. Our fourth section deals with phrases to encourage. These phrases aim to inspire hope and build confidence in the patient. You've already taken a big step by talking about this. Here we have a phrase to reinforce the patient's progress and courage. I believe in your ability to handle this. Here we are encouraging self-belief and resilience. You have more strength than you realize. We can use this motivational statement to boost a patient's confidence. This is just one part of your journey, not the whole story. Here we have a hopeful reminder that their current struggles are not permanent. Every small step counts, and you're making progress. Here we have a way to celebrate small improvements for the patient. What you're feeling is valid, and you're moving forward. This phrase encourages acceptance of emotions while highlighting progress. You're not alone in this, and help is always available. Here we have a supportive phrase to instill hope. Think about how far you've come already. This phrase is a great way to remind a patient of all their achievements. You've got this, one day at a time. Here we have a phrase to inspire perseverance and focus. It's okay to lean on others when you need to. This phrase encourages the patient to seek and accept support. Let's move on to our final section, phrases for self-reflection. These phrases help patients explore their own thoughts and behaviours thoughtfully. What does this experience teach you about yourself? Here we have a thought-provoking question to encourage personal insights. How do you think these feelings align with your goals or values? This helps the patient connect their emotions to their sense of purpose. What have you learned about yourself through this process? Here we are encouraging the patient to have some reflection on their personal growth. If you could talk to your past self, what would you say? Here we have another reflective phrase to help the patient gain perspective. What would you like your future self to know? Here we are inspiring forward thinking and self-encouragement. What patterns do you notice in your thoughts or behaviors? This sentence encourages self-awareness and insight for the patient. What would you like to change or improve moving forward? Here we are prompting the patient towards constructive self-reflection and goal setting. What strengths have you discovered during this time? Here we are helping them focus on resilience and positivity. How do you think others perceive you in this situation? Here we are encouraging the patient to consider different perspectives. What steps can you take to feel more in control? And here we have a phrase to empower a patient to plan and take action. Thank you for joining me in today's lesson on essential English phrases for mental health care professionals. These phrases are designed to help you navigate meaningful conversations with empathy, clarity, and confidence, making a real difference in the lives of your patients. Student members, don't forget to download your essential PDF guide to this lesson. And if you want to join student membership with Learning English Pro, the link to do that is in the video description. If you found this video helpful, don't forget to give it a like and share it with your colleagues. And make sure to subscribe to Learning English Pro. Hit the bell icon so you don't miss out on more lessons like this, tailored specifically for healthcare professionals. Together, we can build your confidence and help you excel in your career. You have come such a long way on this video lesson, and our next topic is our last. This next section covers the top 50 injuries that nurses come across in their day-to-day work. And I'd love to hear from you. Which injury is the most common in your work environment? Let me know. Have you ever struggled to find the right way to describe an injury in English? Maybe you know the everyday term, but not the precise medical name, or vice versa. Or perhaps you're preparing for the OET exam and want to sound more confident when discussing patient injuries. Well, in this lesson, I've got you covered. Hi, my name is Jer, and this is Learning English Pro, the channel that helps healthcare professionals like you excel in English and advance in your careers. Today's lesson is perfect for physiotherapists, nurses, doctors, and anyone studying for the OET. We're covering 50 essential injuries and physical conditions, from sprains and fractures to dislocations and ruptures, all explained in clear professional English. Student members can access a handy guide for this lesson in the membership tab. It includes everything from today's video, plus exercises like my AI-generated homework to help you practice and remember what you learn. Here's how the lesson will work. I'll give you the most commonly used term for the injury, then we'll go over the proper medical name. Next, I'll explain the condition with a clear, concise definition. You'll also see visuals to help you fully understand the term. Finally, we'll look at an example sentence using natural collocations, so you'll learn the right way to talk about these injuries in a real-life medical setting. This lesson packs in a lot of information, so choose how you want to learn. Active learners, watch the full lesson in a quiet, focused space, take notes with a pen and paper, and think about which terms you're most likely to use in your work. And let me know in the comments which injuries you encounter the most. For passive learners, play this video in the background while you go about your day. This is a great way to absorb English naturally without needing to sit down and study. Alright then, let's get started. Our first condition is a broken bone. The medical term for this is a fracture. Let's take a look at our first definition. A broken bone or a fracture is a break in a bone, which may be minor, like a hairline fracture, or severe, like a compound fracture. And let's take a look at our example sentence. The X-ray confirmed that he has a fractured wrist and he'll need a cast. Let's move on to dislocated shoulder. And the medical term is quite similar, shoulder dislocation. Our definition is when the upper arm bone or the humerus comes out of its socket. Our example sentence, he fell off his bike and dislocated his shoulder, requiring immediate treatment. Third on our list is a sprained ankle, also referred to as an ankle sprain. This is defined as a stretched or torn ligament in the ankle. She twisted her foot while running and now has a sprained ankle. Let's move on to pulled muscle. This can also be referred to as muscle strain or strained muscle. It is an overstretching or tearing of muscle fibers. Let's take a look at our example sentence. He lifted a heavy box and ended up with a strained back muscle. Our fifth term is bruise. The medical term for this is contusion. The definition is a bleeding under the skin due to a blunt injury. After falling on the stairs, she developed a large bruise on her thigh. Our next condition is a swollen knee. In medical terminology, this is known as a knee effusion. It is a fluid buildup in or around the knee joint due to injury or inflammation. His knee is swollen after the accident, and the doctor suspects ligament damage. Let's move on to a torn ligament. You can tear a ligament in lots of different places. One common type is known as an ACL tear. It is a tear in the ACL, which of course is a ligament in the knee. Our example sentence is, the footballer was sidelined for months after an ACL tear. Let's move on to torn cartilage. There is cartilage in different parts of the body. One common type of torn cartilage is a meniscus tear. This is damage to the cartilage in the knee, often caused by twisting. He needed surgery to repair a torn meniscus. Our ninth term is a cracked rib. In medical terminology, it would be known as a rib fracture. This is a break or crack in one of the ribs, usually caused by trauma. She has a cracked rib from the car accident, but it will heal on its own. Let's move on to frozen shoulder, also known in medical terms as adhesive capsulitis. This is a stiffness and pain in the shoulder joint, leading to limited movement. Let's take a look at our example. He developed frozen shoulder after months of inactivity. Our next condition is sports related, a tennis elbow. Also known as lateral epicondylitis. It is an inflammation of the tendons in the elbow due to overuse. His doctor diagnosed him with tennis elbow from repetitive lifting. A similar condition is golfer's elbow. This is known as medial epicondylitis, and it is an inflammation of the tendons on the inside of the elbow. Let's take a look at our example sentence. The patient complained of pain due to golfer's elbow. We are already on our 13th term, which is a slipped disc. In medical terms, this would be known as a herniated disc. and it describes a spinal disc that is moved out of place, pressing on nerves. He has a herniated disc causing severe back pain. Next up, we have whiplash. This is also known as cervical strain. It describes a neck injury caused by sudden back and forth motion, often from car accidents. After the car crash, she suffered from whiplash. Let's move on to concussion. In medical terms, this could be called a mild traumatic brain injury, or an MTBI. This is a temporary loss of brain function due to a head injury. Let's take a look at our example. The boxer was taken to the hospital with a concussion. A common injury is a black eye, also known in medical terms as a periorbital hematoma. This is a bruising around the eye due to impact. He got a black eye after being hit in the face. Our 17th condition is a burst appendix. In medical terms, it might be called a ruptured appendix. This is a life-threatening condition where the appendix bursts, leading to infection. She was rushed to surgery for a ruptured appendix. Let's move on to collapsed lung, medically known as pneumothorax. This is where air leaks into the chest cavity, causing the lung to collapse. A severe injury caused a collapsed lung, requiring immediate treatment. Next, we have a gunshot wound. In medical terms, it might be called a ballistic trauma. And of course, this is an injury or a wound caused by a bullet or firearm. The patient arrived with a gunshot wound to the shoulder. A deep cut is another condition, also known in medical terms as a laceration. This is a deep tear or cut in the skin. The kitchen knife accident left him with a deep laceration on his hand. Let's move on to a burn, or in medical terms, a thermal burn. This is damage to the skin caused by heat, fire, or chemicals. The chef suffered a second-degree burn from boiling water. A similar condition is sunburn. This is also known as radiation burn, and this is skin damage caused by excessive UV exposure. After a day at the beach without sunscreen, she got severe sunburn. Our next condition is the opposite of sunburn, frostbite. And frostbite is what it would be known as in medical terms. This is tissue damage caused by extreme cold, leading to numbness and discoloration. Let's take a look at our example. The hiker developed frostbite on his fingers after being stuck in the snow. Let's move on to a nosebleed. In medical terms, epistaxis. This is bleeding from the nose due to injury or dry air. He had a nosebleed after getting hit in the face during the game. Next up, we have knocked out tooth, known medically as an avulsed tooth, and this is where a tooth has become completely dislodged from its socket. The boxer had a knocked out tooth and needed immediate dental care. Another common dental condition is a chipped tooth, known medically as a dental fracture. This describes a small break or crack in a tooth. She bit into a hard candy and ended up with a chipped tooth. Condition number 27 is a split lip. In medical terms, it's known as a lip laceration, and this describes a deep cut or tear in the lip. He fell off his bike and ended up with a split lip. Next up, we have stab wound. This can be known medically as a penetrating trauma and describes a deep wound caused by a sharp object. Our example is, the paramedics treated a patient with a stab wound to the abdomen. Let's move on to punctured lung. This can also be called a traumatic pneumothorax. It describes a lung injury where air leaks into the chest cavity. The patient had a punctured lung due to a fractured rib. We are already at number 30, internal bleeding. In medical terms, this would be called a hemorrhage, and it defines bleeding inside the body, often due to trauma. Let's take a look at our example. The car crash victim showed signs of internal bleeding and needed surgery. Next up, we have a swollen lip. In medical terms, this would be called a lip edema. It describes a swelling of the lips due to something like an injury or an allergy. After the allergic reaction, his lip was swollen and painful. Next, we have sprained wrist, or a wrist sprain. This is a stretched or torn ligament in the wrist. She slipped on ice and ended up with a sprained wrist. A jammed finger can also be called a finger sprain. This is an injury to the ligaments in the finger due to impact. He jammed his finger playing basketball and now it's swollen and stiff. Let's move on to the nicely named turf toe. Better known in medical circles as metatarsal phalangeal joint sprain. This describes a sprain of the big toe. It's common in athletes. And our example sentence is, the footballer was sidelined with turf toe after a rough tackle. Our next condition is one I have suffered with myself, shin splints. Medically, it is known as medial tibial stress syndrome. It describes a pain along the shin bone due to overuse. The new runner develops shin splints from training too hard. An Achilles tendon tear is also known as an Achilles tendon rupture. It describes a complete tear of the Achilles tendon, which connects the calf to the heel. He collapsed in pain after an Achilles tendon rupture during a sprint. Number 37 is a rotator cuff tear, also known as a rotator cuff injury. It describes a tear in the muscles or tendons of the shoulder. The swimmer was diagnosed with a rotator cuff tear and needed physical therapy. Let's move on to a boxer's fracture. In medical terms, a fifth metacarpal fracture. This is a fracture of the hand bones, often caused by punching a hard object. He broke his hand in a fight and was diagnosed with a boxer's fracture. Next up, we have groin strain, also known as adductor muscle strain. This describes an overstretching or tearing of the muscles in the groin area. Let's take a look at our example. He had to stop playing due to a groin strain. Let's move on to blister. This can also be known as a friction blister. It is a fluid-filled bubble on the skin caused by friction or burns. She developed blisters on her feet from wearing new shoes. The term bed sores can also be referred to as pressure ulcers. These are skin wounds caused by prolonged pressure, common in immobile patients. The nurse treated the elderly patient's bed sores with special dressings. Next, we have ear barotrauma. In medical terms, this would be known as barotitis media. It describes damage to the ear due to sudden pressure changes. He experienced ear barotrauma while scuba diving. Our next term is dehydration. In medical terms, it can also be known as hypohydration. And of course, this is a condition where the body loses too much fluid. The marathon runner suffered from severe dehydration. Our next type of injury is an electric shock. You might hear this referred to as an electrical burn or electrocution. and it's defined as an injury caused by contact with electricity. Let's take a look at our example. The worker was rushed to the hospital after an electric shock. Condition number 45 is a broken nose, also known as a nasal fracture. This is a break or crack in the bones of the nose, often caused by impact. The rugby player suffered a broken nose after a head collision. Let's move on to a hip fracture. In medical terms, a femoral neck fracture, and this describes a break in the upper part of the thigh bone. The elderly woman needed surgery after a hip fracture. Compartment syndrome, or acute compartment syndrome, describes pressure in a muscle area, cutting off circulation. Let's take a look at our example. The patient needed emergency surgery for compartment syndrome. Our next injury is an eye scratch. In medical terms, this could be known as a corneal abrasion. It describes a scratch on the eye's surface, causing pain and redness. The doctor prescribed eye drops for his corneal abrasion. Number 49 is a blood clot. There are lots of different types of blood clot. Today we'll cover deep vein thrombosis, or DVT. DVT is a clot in a deep vein, usually in the legs. He was diagnosed with deep vein thrombosis after a long flight. Our final condition is seizure injury, known as a postictal injury in medical terms. This is a trauma caused by uncontrolled body movements during a seizure. Let's take a look at our final example. He bit his tongue due to a seizure injury and required medical care. You've done it! 1,000 phrases across real-world nursing topics. Congratulations! If you've made it this far, you're serious about your growth, and I'm really proud of you. Repetition when learning English is really important, so make sure and revisit the topics that matter most to you and your daily job. And don't forget to join the student membership today for access to this guide, 200 plus English lessons on a variety of topics, worksheets, and so much more. Or grab the guide directly from the YouTube store if that's easier. Subscribe, comment, and share this with all your colleagues. You're not just learning English, you're learning how to thrive in your career. I'm Jer. Thanks again for being part of Learning English Pro.